All right, I'm gonna email Caitlin. We can get started. I'll let them in. I'm gonna give them instructions, or you can let them in.
I'm sorry. Sorry
That's
about
fine.
that. I jumped the gun.
No, don't worry. That is totally fine. Let them get connected. Oh, here's Caitlin. Can we get her in
Yes.
and make her chair? And then she'll take over after I do this, but I'll do it first as Caitlin gets set up.
Okay.
Okay, so if you wouldn't mind changing her title to chair, I'll go ahead and start with the process. So
Okay.
good evening, Sarah and Frank. Can you guys test your mic, make sure it works?
Yes, hi, I'm Sarah Anico. Nice
All
to
right.
meet you.
Nice to meet you.
Oh, hi, Ellie Barto.
Hey. All right, so
Hello, everyone.
so you see a smaller group tonight because the board decided to try something different this year. We actually allowed the board members to choose their priority areas that they wanted to review. And so, we wanted to have at least 3 board members. So it's still technically a public hearing. So we are recording just because there's 3 board members. We did not get any public invited to be heard. Brenda is our community services I'm forgetting your title, Brenda. Executive
admin.
admin, sorry. So she is going to be managing the meeting. I will be doing time. And so I know, Frank, you've done this before. As a reminder, you're going to get 15 minutes. And Caitlin, Deanna, and Robert will be asking the questions. And if I have questions, then I will share those as well. And then if there is time before the 15 minutes end, you will be allowed to, share whatever you want to share. Does that make sense? All right, I'm gonna go ahead and give me 1 second. I'm gonna start the timer. Give me 1 second.
Really quick, can you guys hear me?
Yes.
Okay, great.
You can see you and hear you. Yeah, no, there's a big thunderstorm in South Carolina. So if we do lose power or something like that happens, then because it's not the agencies, it's because of unanticipated situations, then we will find a time to reschedule. Okay, because I know we do have a storm going over Longmont that may impact internet or power, etc. So just be aware, if we get cut off, we will find a time to reschedule. Okay. All right, I am starting the timer now. Board, I'll turn it over to you.
Hi, Frank. Hi, Sarah. Good to see you both.
Hi, Kayla. Nice to see you again. And Robert, I remember you as well.
Hello.
I thought I'd kick us off. I do have a question. So I noticed in your application that you mentioned that there was about a 20% increase in diagnosis of for people living with HIV in 2021 over 2020. I'm curious if, and that was statewide, I believe. Is that correct?
Yes, that's based off statewide surveillance data from CDPHE.
Got it. I'm curious if you have some insight into what was driving that. Yeah.
Absolutely. So I think there's a couple of things that kind of surface to the top of addressing that reality. So I think one is that during COVID, there was a halt in services, a lot of gaps in services for a period of time. So there was some significant period of time, more so in 2020 than 2021, although it did continue into 2021, where services weren't as accessed or as available, or people had to, go through a bit more of a process to access services. And so I think one of the components is there were probably less people tested in 2020 than there were in 2021. Also, throughout the pandemic, we saw, a lot of impact on individuals who were struggling with mental, emotional wellness. We saw an increase in substance use patterns, including, higher rates of opioid use, higher rates of crystal meth use. Particularly with crystal meth, that's a substance that people often use for sexual activity, which can decrease judgment, decrease inhibitions as well, which can lead to higher risk-taking behavior. So I think it's a combination of shifts in testing and access of testing, and then also kind of increased behavioral risk. And then now that the testing is open, we're seeing more diagnoses. We're also seeing that trend in 2022 as well. And that's not just specific to HIV. We also saw increased rates in syphilis, gonorrhea, chlamydia as well.
And does that match like, oh, sorry, go ahead, Deanna. I'll jump in. Sorry.
Well, I could let you go too, but my question sort of ties in with that. I had noticed that because I was on last year's review too, so I had noticed that you had accessed some additional funding sources through emergency funding, sort of through the COVID pandemic. So I was wondering if those funding sources are still available to you, and sort of what that funding looked like, because it does sound like you have an increased need going out of the pandemic, right?
Yeah, so specific for those types of fundings, I think we had access to the most in 2020. Some of that access continued into 2021. We weren't eligible for a PPP loan in 2021, which, double-edged sword. We weren't eligible because we did well enough in, 2020 to not qualify. Where I've seen the financial assistance that we've been eligible for the strongest is in funding that supports food insecurity and resolving that issue. So that I would say has stayed consistent between 2020, 2021, and 2022. That funding is still pretty accessible. I think what we've seen with some of our government funders is stretch as much as they can to help support access to the basic needs, housing, utilities, transportation, oral health care, like just all those basic human needs, and programming and case management that really helps people, move in the direction of more stability. But I would say food pantry is really the continuance of funding in 2022.
Okay, thank you.
Robert, go ahead.
I'm filling out a term, so I haven't been with the group for very long, and I'm somewhat ignorant about a lot of things. And one is, I'm wondering, do you do anything? It's called the Boulder County AIDS Project, but there's also another disease that's connected with AIDS, which is monkeypox, and I'm wondering if there's anything you do about that. That's my first question. The second question is, we're going to be looking into another group called Queer Asterisk, and it seems like the Boulder County AIDS thing and Queer Asterisk sounds redundant to me. I'm maybe, I just don't know. I'm just wanting to know if you can clarify that for me.
Absolutely. So I think to answer your first question, so BCAP has been at the forefront of both COVID-19 response and MPX response, working in collaboration with Boulder County Public Health, and also with a number of community partners like out Boulder County, who's done a lot of equity work in both of those epidemics. But what we find when epidemics like this emerge is it just really illuminates the syndemic nature, right, of what people who are experiencing poverty encounter, and the access points that become even more challenging than potentially otherwise. So yes, we are definitely prioritizing and integrating both COVID-19 response and MPX response into our all the services we provide at client level work. And then in terms of Boulder County AIDS Project, how are we unique from probably all the organizations that you'll be hearing from is that BCAP provides HIV services specifically to people living with HIV, and then some prevention services that work with people at greater than average risk of acquiring HIV in very unique ways. And I'm going to pass the baton to Sarah so she gets an opportunity to share as well, because she knows a lot about all these programs too.
Hi, everybody. And also I was just gonna add to that, I'm not in depth, I'm not very super familiar with Career Asterisks, although I do believe that they have more of a mental health therapeutic approach for the LGBTQIA community. And so while we do link people who we're serving, who are either living with HIV or at risk of HIV, to mental health services when that's something that's needed or requested needed, then although we do that, we do a lot outside of the realm of mental health as well. And also we do serve people, the general public, as well as people who identify as LGBTQIA, of course, but a much greater population than that is served by BCAP, because HIV, I mean, anyone can get HIV, anyone can get monkeypox. Yes, we have, larger proportions of people affected by these viruses potentially in the LGBTQIA communities, but we're definitely here for everybody to get the information and testing access, et cetera. Ellie Garcho is your hand up. Or are you your chair? And Caitlin, sorry, I didn't know.
Oh, no, you're fine.
Oh.
I'm not on all the hearings, so I'm not quite sure if I should be like recognizing people or not.
Yeah, you're the chair. It's a public
Okay.
hearing. You're the chair. You get to recognize folks.
Go ahead, Alberto.
So I to answer Robert's question, because I've Career Asterisks primarily focuses on mental health, where BCAP is much more of a physical health. Not that they don't do stuff, but very different agencies with different missions and purposes and goals. Even though there might be some crossover with clients, right?
Mhm.
But
Sure.
Different level of service. My question is, of course, as you know, the board looks at your programs, your mission, making sure you're meeting the needs that we identify in our goals. But the staff reviews your financials, staff reviews more your strategic planning, that kind of stuff. So my question was, I recently have been doing a little more math when I look at the request, and when I see, the majority of your funding, Frank, for your agency comes from CDPHE, right? That's number one. And I guess the question is, are there questions? Is there any concern about CDPHE shifting funding? That kind of stuff is always scary. Two, your request is about 0.7% of your total project budget, right? The request from Longmont. How does that, I guess for the board to know, how does that 0.7% help your agency? I just like for the board to know that. But again, the bigger question is, whenever I see, a huge chunk of money coming from a government agency, I'm always a little concerned, because that could change.
Great questions. So part A of the first part of the question. So the federal government allocates a budget for HIV services that gets administered through Hersa. And then Hersa awards dollars to each state based on HIV surveillance data, and then potentially any trends that are just so needing to be addressed. So the state of Colorado gets a dollar amount to work with in terms of awarding contracts who specifically do HIV services work. And it's divided up into regions. And so BCAP is eligible to apply for Part B funding for the regional service provider Part B contract, essentially, when there's a competitive RFP. So we go into a competitive RFP for this, and we are the only HIV service organization serving Boulder County and in plant in Boulder County. So the award that we receive is specifically to address some of the needs, right, that for people living with HIV in our region. I would say I've worked here since 2006, and although every time we go into session, people are worried about, and who might be in political power, like what's going to be potentially shifted or cut. We haven't really seen as of late a lot of threat to HIV specific funding. I think because in terms of local communities, public health doesn't have the infrastructure to do the work that we do. They're not set up to do HIV case management services for people living with HIV. And so it would be a huge undue hardship to local governments across the United States if this funding wasn't kept intact and there wasn't the balance of community, community-based organizations doing the work in collaboration with local public health and state public health. So I think the other thing to think about, we do receive a lot of funds from the state health department, but we also receive funds that are quite diversified and coming from different funding streams. So we see a big bucket of money coming through CDPHE, but again, like our regional service provider contract is made up of a variety of funding sources that then show up in like one contract, and which helps with the flexibility and adaptability of how some of the funds can be used, and then also just provides more overall support with it being a bit diversified.
So we got 1 minute left. So if you could, yeah, talk to the board about how our 0.7% of your budget.
You know, BCAP also studies and tries to follow the budgets of who's funding us. And we always try to balance submitting a respectful request in relationship to all the organizations doing great work who also need funding and who support BCAP in turn and support our clients. So it's hugely valuable to us to be represented in the city of Longmont, to have services in the city of Longmont, to do as much equity work as possible, and to work collaboratively with the government and with the City of Longmont Human Services Fund. It's really important to us.
Okay. All right, so we have about 20 seconds left. I'm not sure if you want to close us out with any statement or if anyone's the one that's last minute questions.
I just want to say thank you for what you're in service doing and how you uplift BCAP and have in the past, as well as organizations. Very meaningful.
Yeah. Same, and I appreciate too, Robert, your candidness about not being as familiar with some of the organizations you're going to be looking at and research, interviewing. And I think that's great to just, how can you be? There's so many services here. We're so fortunate in this county. So I just wanted to thank you all for your time too.
Thank you. So Caitlin, the time has elapsed. Thank you,
Thank you
Frank
both
and
for being
Sarah.
here.
And in about 2 minutes, we'll
Thank you.
let the next group in. So for board members, Robert, this is your first time. Any questions? This is typically how it goes. Question and answer. Just want to make sure we got a couple of minutes before we get and they're already in the waiting room. So at 5:20, Brenda will let them in, but just wanted to make sure there were any questions or for this is your first time.
Apologies, I'm rehooking up a microphone here that got removed by a child earlier, so
No worries.
you'll actually be able to hear me a little bit better, but I'm here and I'm listening.
No worries. All right, so the next group is going to be Boulder Valley Women's Health. They just did hire a new ED, but she couldn't be there. So they're the Susan Conley, who was the interim ED, is here tonight.
Can you all still hear me? Is that working?
Yes.
Yes,
Okay.
that's great.
Yes.
Fantastic.
I think the storm passed too. I'm not hearing thunder anymore.
It's starting to rain.
I hear a lot of rain outside and wind a bit
Right.
here.
Yep,
Okay.
Same here.
Yeah, I think for us, I'm in Southwest Longmont, so I think it has passed for us here in Southwest Longmont.
Yeah, it's quieter for us over here now too.
Yeah. All right, do you want to let her in?
Yep.
And
Done.
Caitlin, I'll let you do the introductions and I'll take care of timer.
Thanks.
Good evening.
Hi, Susan. Thank you so much for being here.
I'm sorry, I have a ghostly glow.
We'll blame it on the storm that's coming through. It's giving you a nice, a nice new tint for the month. So I'm Caitlin Abbott. I'm the chair of the board, the advisory board for housing and human services for the city of Longmont. You may or may not be familiar. You'll only see 3 board members here plus staff member Eliberto. We have split up the hearings this year with at least 3 board members in each sort of focused area to allow us all to dig a little bit deeper into a subset of the agencies that are applying for funds. So if you have been to these hearings before, sometimes you will see up to 9 or 10 people for the board. Tonight, you've got the 3 of us who are focusing in on the health and well-being agencies. So Eliberto is going to keep our time for us. We've got 15 minutes and we'll have an opportunity for board members as well as Eliberto to ask questions. And then if there's extra time, we'll let you kind of speak to your agency or the program if there's anything we've missed that you'd like to make sure we know about. So
Thank you.
Starting
are
it
we
now.
good?
Yeah, I just
Okay.
started it.
Does Deanna or Robert, do either of you have questions? Okay, Deanna.
So I had a question about demand for services in light of the changing landscape for healthcare access for women. I'm wondering whether your agency has experienced an uptick in people traveling, maybe from out of state to access services, and commensurate with that increase in what I'm estimating is probably an increase in services. If you've seen an increase in donations as people have sort of rallied around the cause, or maybe you could just talk about those 2 points.
Sure, yes and yes. We started seeing patients from out of state for abortion services in particular before the Supreme Court decision. Of course, some states were already tightening litigation. Then a tremendous uptick in appointments made and appointments kept, which are 2 different things. Immediately following the Supreme Court decision, we are seeing people from Texas, Oklahoma, Nebraska so far. Our numbers are such that we are considering, currently we provide abortion services only 1 day a week. We are considering opening a 2nd day to make sure that we're providing for our local and state need as well as the needs of the out of state. Our donor base is highly motivated around reproductive justice. So we have seen a huge increase in our donations this year. It will be interesting to see if that impacts what is more traditional end of year giving. So we're very, very excited, but we're also kind of holding our breath to see if people came out early or if they will come out again at the end of the year. But we are at this point in time ahead of budget, and people are passionate. It's just not dollars. It's like, how can we help? We've had private foundations, even from out of state, contacting us. They really care about supporting the local independent providers who also are able to serve out-of-state patients.
Thank you. And also, just for the record, I realized I said women's healthcare services. That was not a very gender affirming term. So I just kind of wanted to correct that for the record, that I had said that incorrectly. So, but thank you.
Well, and if I can quickly say, there was a while that we referred to ourselves shorthand as women's health. We have really moved away from that. So it's amazing how quickly I can say BVWHC, because I've now been saying it so much. We serve all people. So we want to make sure that we are conscious of our language as well. So thank you.
Thank you.
Eliberto, I saw your hand and then I have a question. So go forth.
So Susan, the board and staff, we evaluate applications different. They have their own set of questions. I have my own set of questions. And one of the things that I look at, not that they don't look at it, but it's actually part of my score, not theirs, is questions around how you describe your unique services that you provide and how you ensure not to duplicate services. And what I didn't see as much, I think your strategic goals were fine, but what I didn't see was a conversation about how you work closely with other providers. In particular, I'm thinking about those independent nonprofit providers like Hope Light or Salud or whoever else is in Longmont. And so I just wanted to ask a question about, I'm sure you do, but it wasn't in the application. So I'd just like to hear a little more about how that works.
Sure. And I'm sorry that wasn't in the application. I kind of think that reflects the more recent history where we've had a goodly bit of transition in our leadership. Our new CEO, who I'm sorry I could not be here tonight, Dr. Savita Ginde, has relationships that we haven't had previously and is very interested in really optimizing those relationships. So I know she's been in touch with the Our Center. I believe she's been in touch with Salud as well to understand how can we support the patients that they can't see or patients who prefer to come to us. I think we will see much more of that in the Longmont community, given our new leadership. I would say one thing that we've heard from patients that we're aware of, some female patients prefer to come to us versus Salud because they feel they can be guaranteed of seeing female providers. And that's important to them. They said, even if they are able to make an advance appointment at Salud with a female provider, sometimes it gets changed at the last minute and they're uncomfortable with that. So we know that's one way we can work to complement Salud, but we have more work to do there for sure. And I'm making notes of that. So thank you, Eliberto.
You mentioned some of the organizations that have reached out from out of state and wanting to support some of the local things, and also some expansion of your programs to address specifically needs within Colorado, given sort of like the influx of folks coming from other states where they may not be able to receive services or receive services as easily. I'm kind of curious what you see as the top maybe 2 or 3 things that Colorado and really Boulder County, since that's primarily your service area, is what folks need here that that you're helping to address that's really specific to Colorado.
Well, access. It's amazing. We are seeing more and more uninsured or underinsured patients. And, we think the Affordable Care Act, yes, it has given more options, but they still don't work for all patients. So providing access for the various parts of our community that have barriers, whether it's financial, whether it's a comfort level, the LGBTQ plus community, we work pretty closely with Boulder County to make sure that we are seen as a resource for gender affirming care, but in general for LGBTQ folks. Who may not always be comfortable in more traditional settings. And just in terms of providing enough appointments for our community and those from outside of the community, we've had interesting, these are subtleties, but you might be interested to know. We've kind of in the past prided ourselves on relatively long appointments so that our patients can talk about anything they want to talk about, everything they want to talk about. What we realize is not everybody needs that or wants that. People value efficiency. And so we are moving toward shorter appointments where appropriate, longer where it's needed or desired, but having literally more appointments through the day. In the past, we closed for an hour at lunch. Well, we're going to work, we'll have appointments 8:30 to 5 every day. So we're making sure that we are having literally more opportunities for those who do want to come to see us.
Great, thank you. Other questions? Alberto?
I'll always give up my time for board members, but if board members don't have a question, then I do. So again, I mean, board members look at certain aspects of your application and staff looks at other. And I guess my other question was, I mean, when I looked at your audit, it seems that you are in a strong, you had a stronger year in 2020 than you had in 2019, which is good. And it seems you're in a strong financial position. But can you explain to me a little more about your reserves? And it feels like you have a lot in long-term investments, but how does that help in times of a financial crisis, I guess?
Well, fortunately, we're not in financial crisis, but those are considered rainy day funds. And I think we have, I'm paging through my application, 260 something thousand in what we call long-term investments. It's basically in bonds. So we might as well have it in a bank account. It's not like we're making a lot of money. But yeah, that is considered to be a rainy day fund. We haven't had to access it. We also have a letter of credit. We renew a letter of credit every year with a bank. We have not had to draw on the letter of credit in, I'm not sure how long. I've been, I was on the board for the last 3 years. I became the interim CEO earlier this year, and now I'm just helping with special projects. But in the 4 years that I've been around, we have not had to draw on the letter of credit. We are looking to always increase our earned income and not be as reliant on our contributed income, but we are because we're providing subsidized services. But if we can make sure that we are getting everything we should and could be getting from the insurance companies, for example, it's not so much about raising the fees to our patients. It's really about all of the sources of income that we can find. So yeah, we hope not to have to draw on that rainy day fund anytime soon. It is there for a critical time. And we were kind of shocked during COVID because our patient numbers fell dramatically, as probably all healthcare providers experienced. But we did not have to draw on that. We were able to get through.
And so, and a follow-up question to that is that, I was doing the math and looking at your budget request. And so I guess for the board to hear, when you tally it, you're asking, I think, for 25,000 is what you're asking for the city of Longmont.
Yes, yeah.
I mean, that's basically less than 1% of your total project budget.
But thank you for making that point.
And so I guess so so the question I just asked the previous agency is like, so what does that mean for you? What is that, what is that less than 1%, that 25,000 for the city of Longmont? What does that mean for BV? And I can't remember.
BVWHC.
Yeah.
Well, part of it is almost the moral support, knowing that the city of Longmont cares enough to support us, and that's no joke. That matters. I think in the future, it's funny, I was doing the same math because if you allow me a few minutes, I would have made that very point. I would love to in the future, and it probably will not be me, but a future development director to really more closely align the patients and the support that we seek. And we know, not every city even supports health and human services. We appreciate that Longmont does. So anything is helpful. But the cost of service right now for each encounter is, I'm going to look at my notes to be sure I'm accurate, $535 for the subsidized services, not abortion. We separate everything into our abortion services and our what we call our subsidized services. $535 per encounter, per appointment on average. We recover about 35% of that through insurance or self-pay. Even a subsidized patient, it's a sliding fee scale. Some patients pay something for services. So Yeah, we're asking for a relatively small amount. The cost of providing services to the 494 Longmont patients that we project next year at $535 a pop is $264,000. And that doesn't even include the, more than 400 students that we expect to see. So we hope that we are providing value for the community. And we would certainly accept more, but we didn't want to be greedy. Our request this year is about 15% above what it was last year. And I have to say, I inherited it. So I can't say how they came up with last year's number, but that's what our number is for this year, about 15% higher.
I appreciate that. We have about 50 seconds left. So Susan, if you have any parting words or there's any last minute question from the board, this is the time to share it.
Again, we appreciate that Longmont cares enough to support. It is a moral support as well as a financial support. And we look forward to being even more closely tied to the Longmont community going forward. I think there's some exciting things ahead, including I hear that there's going to be an I Have a Dream Foundation class in Longmont. And we would like to work closely with the middle school and the high school kids on education and outreach. So thank you.
Thank you very much.
Appreciate
Thank
it.
you so much. Susan.
Have a good evening.
Thank you.
You too.
So Kayla, we got about 4 minutes before our next group. Don't know if you want to do a quick bio break or if we're good so far. This is going to be a long night, so it's one of our longer nights. I think this one, and I think education and skill building are some of our longer nights.
Yeah. Seems like
yeah.
a good chance to grab a quick drink if anyone needs it or use the restroom. So
Yeah,
everyone a minute or two for that.
yeah, because the next person's already here, so but we got time. All right, so we're about a minute away. I see a Mark Howard and Lauren Brenda. I'm assuming those are the folks for dental aid. Not sure if Brenda's there.
Yes, I am. Yes, actually, that's dental aid representatives. And
Perfect. So we got two representatives from dental aid.
yes.
All right, we got about a minute, and then we can let them in.
Okay. And Lauren, I think her last name is Riggy or Riggins.
Riggins, yeah, Laura Riggins. We've had a few conversations.
Okay.
Is that a bear at the bottom of your thing? I always wonder what that is, Caitlin.
It is. I think that this background was created by Behr Paints, Behr, and that's the logo. And so it shows up at the bottom of the background.
Okay, all right, just wondering. All right, it's 5:40. We can let them in. Mark, can you hear us? Oh,
Oh, it's muted. Mark, you're muted.
There we
It looks-
go. That's
There we go.
yeah, we just,
now.
We can
Yeah.
hear you. Oh,
Yeah,
and
but-
it looks like Lauren finished connecting.
okay, good. I'll turn it over to you, Caitlin.
Lauren, can you hear us?
Lauren, you're muted. And Michelle Montroy and Jose Mena should be joining right now, actually. Here we go. You're muted, Lauren.
Thank you.
Hi, Michelle. Hi, Lauren. Hi, Mark. It
Hello.
sounds like we may be waiting on one other person, or we may have one other person joining us soon. So I think Brenda, if they come, we can let them in, but we'll go ahead and get started. Hi, everyone. I am Caitlin Abbott. I'm the chair of the Housing and Human Services Advisory Board for the City of Longmont. With us tonight, Deanna and Robert are both members of the board along with me. And then we've got Eliberto Mendoza, who's staff member who works with the Housing and Human Services Advisory Board. You've got a subset of the board here tonight. This year we have decided we split things up by focus area to allow everyone an opportunity to dig in more deeply with our various agencies and understand more about specific service areas that we fund. We've got 15 minutes and Eliberto is going to keep time when we get started. And the way this works is we will ask the board members, and Eliberto may have questions about your applications, And then if there's any time at the end, we'll give you an opportunity to add anything that we may have missed that you think that we should know about.
All right. Timer started.
So, all right, timer is started. We got a lot of these hearings, so we're getting pretty good at moving them along. Robert or Deanna, do either of you want to kick off with any questions? Okay, Deanna.
I can kick it off. So I'm wondering if you could explain a little bit how your organization differs from some of the other organizations that provide dental care to other people in Boulder County.
Absolutely. So with Dental Aid, we see a full range of all the way from very young children, like 1 year old, all the way to elderly patients. And a lot of them are undocumented and don't have any coverage at all. A lot of them who do end up using a lot of the funding that we are gifted are sometimes within that pay range where they don't quite qualify for Medicaid, but they can't necessarily afford things. So that's where a lot of those kids fall into place, and younger adults. A lot of our older adults, even when they do have Medicaid, a lot of their services are still not covered, and they only have like a limit of how much they have per year. So I think we try to go above and beyond and find ways to help them, whether it's triaging their treatment to be like, hey, this is the most concerning area, let's start here. And we just really try to make it feel like a dental home for the patient start to finish, and really pride ourselves in just trying to include everyone who comes into our doors, whether they have coverage or they don't, or they're documented or they're not, just looking at them as a patient and part of our family at Dental Aid.
Michelle, may I add just some quick
Absolutely.
things? You knew I couldn't resist. Deanna, I would probably add two more things. 93% of our patient base is Medicare, Medicaid, or uninsured. I don't think anybody else has anywhere close to that percentage. And we provide the full range of dental services. Nobody that does the services to Medicare and Medicaid and uninsured that we do provides the full range of services. They tend to be much more focused. So I'd say those are the two primary reasons that we're different.
And then I would add on to that, we do offer the same type of procedures that a private practice would offer, but also accepting Medicaid patients and people that don't have coverage at all. So, and then Dr. Mena, who's our dental director, he's hopped on. So he might be able to add into that just what differentiates us from other dental providers in the Boulder County area.
So, hey, Michelle, yeah, the main thing is we do, there's a lot of, there's other nonprofits that, will take care of some of the patient needs, but unfortunately, some procedures that need, that have a lab fee attached to them are ones that unfortunately, some other providers don't offer. Like, for example, say if we have a patient, say an elderly patient that lost their dentures, obviously, having dentures made has a lab fee attached to it. So one of the things that we can do is we can start taking impressions and basically do all of the necessary steps for those new dentures to be made for the patient. That's definitely a big one right there. That makes a huge difference, of course, for a patient is if they're able to, dentures can help a patient chew, eat their food. Other things are procedures like say a patient needs a crown on a tooth, that it's got a lab fee attached to that too. So yeah, I think that's one of the things that makes us stand out is that we do provide those procedures. Yes.
Hi, Alberto. You're muted.
My hand is up for Caitlin. She's the chair, so I'm getting her permission to ask questions. Sorry, Dr. Mena.
Go ahead, Alberto.
So just so you know, so the board reviews, I know it's a very long application, and the board reviews certain aspects of it, and me and another staff member as staff review other aspects of it. So some of the main things that I review, and I want to say great job on your strategic goals. I just loved how they were laid out. So good job on that. But I also review, and this is an issue we've had with many agencies, I also review the diversity and inclusivity of your board. And I noticed that there really isn't any in your board at this point. And so I just wanted to check in on that work. We see it as a very important part of our funded agencies to ensure that they are committed to that work. I know it's hard work, I get it, but just want to check in on that. And then I have a follow-up question on your financials too.
Okay, great. So first of all, that's been a topic of our board discussions the last 3 months, and we're actively talking to people and trying to find some more diverse candidates, and really just trying to find some individuals who can help us get to our next step and goals and have some experience that can help us get us to achieve our goals. So I'll let you chime in, Mark.
Sure, I'm actually the chair of the board, and started a year ago. And in fact, about half the board is about a year in. We actually, and I think the second board conversation that we had when I joined, we said, just to be blunt, guys, we got a bunch of white males here, middle-aged and older white males. We've got to start introducing some diversity and a greater sense of diversity. So we've got 2 of the board positions opening up. The 2 terms are ending this year. This calendar year, we're very actively recruiting at the moment and very actively looking. And priority number 1 is some diversity. We do have some characteristics that we're looking for those people. because we've got some knowledge and capabilities. I have no doubt they are available. It's just a question of us finding them, and we're working on that.
Okay, thank you. And then my follow-up question, and I know it's been difficult these last few years for dental aid, but I guess the concern that I have, because again, staff reviews your financial position and more of your agency level, where the board is reviewing your program and the services you're providing. And so according to your year-end 2021, you had quite the loss at the end of 2021. You've been hitting your reserves, which I totally understandable. And I guess I just like to hear a little more about briefly what the plan is to turn things around.
Yeah, so I'm also kind of new to dental aid as the executive director. So I started in December. I have a background in for-profit dental practices and doing some coaching and financial forecasting with them and things like that. So first thing that I did when I came in is I identified some of the processes that could help us essentially get to a higher collection rate from the services we're actually doing from the patients. So as of this year, we've been able to get most months our collections at about 96% of our production, which is great. So that's huge from last year. So that's been one huge thing that we've been able to celebrate recently. And then another one is we were actually in the positive last month. All these little operations that we've implemented, obviously they're part of bigger strategic goals, but you have to break it down into smaller little activities to implement with the actual team. So with all of that and just identifying the strong members on the team and those who can help us turn things around, if you will, and just laying out a game plan and stepstones for them to be like, okay, we need to do this operation differently as part of this bigger strategic goal. But we were able to have our bank accounts go positively last month, and it's been a lot of hard work from everyone on the team and our leadership.
Michelle, may I?
Absolutely.
So when we had the 2022 strategic level planning discussion for the board back in January, or may have been extended into February, priority number 1 was financial stabilization. Priority number 2 was financial stabilization. Priority number 3 was financial stabilization. The board said that's all we want to talk about this year. And Michelle and Dr. Mena, as Michelle described, Dr. Mena and the staff have introduced a lot of changes, operational changes, that we think are going to be sustainable, and we have made some investments this year that are going to improve our financial position. And as Michelle said, last month was the first month that our monthly collections exceeded our outlay for expenses. Right now, we think that's going to continue. That's going to continue. We're going to be continuing to have much more positive months than negative months. And so we don't think we're out of the woods yet, but we recognized the position that we were in at the beginning of the year. We've really very actively been focused on it, and we think we've started to turn a corner.
I wanted to echo Eliberto's comment earlier where around the strategic goals. So he dove in a little on the financials, and what I hear and what I read about those goals and who sort of the vulnerable populations are that you're targeting seem to go like those match, right? Like hitting folks who have put off dental care through the pandemic, and that sort of thing, that, you know, really actually just dovetails nicely for your organization as well. And so I think, you know, being able to marry those two things can be really difficult for a lot of our partners. And so, you know, what I'm hearing seems like really well reasoned targeting of vulnerable populations and folks who have put off care because of, you know, COVID and other things, you know, but that also helps bring in folks, you know, for increasing that care. So just a comment on that I think that that's really great that you have found, you know, a way to tie those two things together in a way that sounds like, you know, as I'm looking at it, I'm like, oh yeah, that makes a whole lot of sense. You know, so I'm hopeful on your behalf. You know, and I also think that, like, in my experience, you know, we see a lot of folks that like focus in on like early dental care and kids, and I know you all do some of that. And there's this entire population that you're targeting with mental health care and, you know, at risk of homelessness that often get left out of many of these conversations. And so I think that is something that, you know, we're really conscious of. Housing itself is actually a very big priority for the city, but that, you know, all the other focus areas that we touch hit that, right? And so, you know, folks who aren't confident or who are uncomfortable or whatever, it's harder to get a job and maintain housing, you know, all the things that come from that. And so I just wanted to say thank you for that.
Oh, thank you. I think just making care accessible and easy to find someone. So if we're able to outreach to people, it kind of removes one barrier for them. And sometimes some of them, that's all they need. So.
Robert or Deanna, do either of you have questions? I have this suspicion that we're creeping up on
we have about a minute left.
I would like to get something in before our time is up. I noticed in looking back over the application that the patient numbers that I have in that on that first page are slightly deflated, actually, relative to the table with the projected clients served. And so I just want to make sure that in terms of patient numbers, you know, however much that contributes to.
Yeah, you can send that to, if you got updated numbers, you can send that to me, Lauren, and I'll send it to the group, to the board.
Okay, that sounds great. Perfect.
Thank you.
Is there anything else that you all, that, I mean, we've sort of been all over, we've had multiple different questions, but is there anything that we haven't touched on that you think that we should know as we move forward?
So if I may, I'd like to add one thing. So one of the things that, you know, that's happening, especially, you know, as the whole, you know, healthcare environment has changed after COVID, is that, you know, as it becomes even more and more expensive to provide care, there are a lot of, you know, there are other dental providers that are not able to serve the community that we serve. Like, for example, you know, there's a lot of providers in Boulder that are no longer taking Medicaid. So those patients need a dental home. And then one of the things that Dental Aid has, you know, has always tried to do is to provide a dental home for patients, you know, that you know, as Michelle said, you know, have trouble accessing care at other places.
Yeah, we are hearing that there are some outfits in town, some practices in town that did accept Medicaid at the beginning of 2022 that are no longer accepting it. I'm going to look into that a little further, and I'll let you know what I find out. But that is something that could contribute to our patient numbers in 2023.
Yeah. So one of the things that we're finding is, you know, like as patients come in, you know, for exams, you know, one of the things that we hear a lot is, you know, our previous provider no longer takes, you know, my insurance or no longer takes Medicaid.
Right. So our time is up. We have lots of hearings, so we're trying to keep on a pretty strict to time basis. So we appreciate your time. Thank you for joining us.
Well, we appreciate you guys having us and looking over our application, taking the time with us this evening.
Thank you.
Thank you for consideration.
Thank you. Thanks for the opportunity.
Bye.
Thank you so much. Bye.
So we have so our next group is going to be coming soon, and they are new. I will say my biggest question that I'm gonna ask is about, even though it's not typically my area, is around who they're serving. I like to know a little bit more. So,
If you're ready, they're available now.
okay.
Okay.
Hi, Jordan. Hi, Emily.
Hi, how are you?
Good. How are you? Can you hear
I'm
us
doing
okay?
well. I can.
I can hear you. Can you hear us?
Got you both.
Great.
My name is Caitlin Abbott. I'm the chair for the Housing and Human Services Advisory Board this year for the city of Longmont. You'll see with me, we've got Deanna and Robert, who are both board members, and then Eliberto is a member of staff for the city of Longmont. He'll also be keeping our time when we get started. So this is a subset of our board this year. It used to be in the past that all board members would attend all hearings, which is a pretty significant time investment, but it also means that many folks are being stretched thin. So we've got groups of 3 that are handling different focus areas for the city this year so that we can dig in a little bit more deeply on the various service providers. So I mentioned Eliberto will be keeping time. We've got 15 minutes that we are sticking pretty close to make sure everyone gets in. And typically we will start with questions from the board as well as Eliberto on behalf of staff. And then if there's any time at the end, we'll give you an opportunity to add anything that you think we might have missed. Any questions before we get started?
No, ma'am.
Okay. All right, Eliberto is starting our timer and then we will get started. Deanna or Robert, do either of you have a question to start with? I know Eliberto had one. So if you want to go ahead, Eliberto, and kick us off.
Yeah, so I am talking to Freedom Revive, right? Because I put them in order, but just want to make sure that I'm at the right agency. We just have a lot of agencies tonight. So I think my question really, I have multiple questions, but my first question is, the human services funding is really meant for low and moderate income. And I'm sorry I didn't have a chance to have this conversation beforehand, but just want to make sure who your primary participants or clients are, just to get a bigger picture. And then I have some other questions about other stuff, but I want to start there.
Okay. Jordan, did you want to speak on the income level of the clients that you're serving in Longmont and volunteer departments that you also serve?
Yeah. So the income piece is interesting because in the first responder world, right, every department has a different pay structure based on the tax dollars that their city or their county brings in. So it's a little bit all over the board, but the average wages of a first responder statewide in the state of Colorado are still in the mid 40s to low 50s. There are departments in the county of Boulder and in the Longmont area, such as Mountain View Fire, that those responders do make significantly more than that, depending on their rank or how long that they've been at the department, because each year that you're there, you get a little bit of a pay increase. But there, like Emily said, when you talk about averages, there are those volunteer agencies still as well that we do serve that don't make any of the money from the departments that they work for. And I don't ask for their income levels of the other jobs that they work, obviously. So I would say definitely in that mid income range would be a pretty good average for most of the responders in the city of Longmont that we're serving.
And I'll just add on to that. I do know that City of Longmont contracts with American Medical Response, and that's a company that I've worked for before, and they are just barely above minimum wage. So I know that a lot of the folks that work on that ambulance are working 2 or 3 jobs just to get by.
Yeah.
Great.
Thank you.
Other questions? Deanna, Robert? If not, I will jump in. So this is your first year applying in the city of Longmont, so welcome to the process. I'd love to hear a little bit about just, what got you involved with this. This is a new agency to us, and so learning a little bit about you and why this is important for you is really helpful to know.
Yeah, so our organization, we really strive to serve first responders statewide. And, we started close to 2 years ago. We've been in business, so to speak, for 2 years, serving responders. And primarily we were with my old fire department and the surrounding areas, which is Adams County, the city of Westminster. But as you guys know, in the state of Colorado, we've had some pretty significant things happen with our first responders. And our goal has really just been to provide the best service that we can to each of the departments that are out there, and slowly getting into Boulder County and the city of Boulder after the King Super shooting has just made our way up into the Longmont area. We work closely with Mountain View Fire. We work closely with some Longmont responders currently. And so when Emily brought this to our attention, it just made sense from the aspect of wanting to serve these communities more and more.
Yeah, and Jordan's a first responder as well, and so that's how he got started in this.
I'm sorry, I thought you were kind of referring to the Longmont application, but yeah, I mean, briefly in a minute or less, I started Revital because I went through my own challenges as a responder, and quite frankly, I almost lost my family because of those challenges, and I had to give up my career in the fire service, which I worked so hard for, especially the paramedicine side of things. And when I left the department, I had more people reaching out as I was a peer supporter there than I ever did when I was working. And it really opened my eyes to the fact that our responder communities are hurting and they need support, and we're losing responders at a high rate, either from the job or to suicide or alcohol abuse. And it became a deep passion of mine, and we just found a little bit of a niche of how we go about serving those responders right now.
And just to add on to that, I'm a contract grant writer for Jordan, but I'm also a first responder, which is what really drew me to his organization. And everything that he is speaking to, it's become a huge epidemic of mental health issues among first responders. And I can tell you that the income levels vary so much. There can be a lot of wealth in fire departments, but then there can be a lot of poverty as well. And that it's just hard to say when it comes to income, if we're serving primarily low or moderate or high income, because the average is hard to put together for that. But these are folks that are really stigmatized when it comes to seeking mental health. So they have a big disparity in that area.
Got it. Deanna.
So I know obviously your organization is relatively new and doing something really interesting that we haven't seen before. So thank you for the work that you're doing for a very obviously important segment of our population. I was looking at your board demographics, and one of the things we also think about is diversity on the board. And I know as a new organization, your board is still pretty small. So I'm just wondering if you have any plans for the board, what it's going to look like, and how you diversify that board too.
Absolutely. It's a hot topic with me right now, because I just got done collaborating with an organization who had a really diverse, large board, and they were able to help in so many capacities of a conference, a wellness conference that we just ran. And so, yes, my board is fairly small. There are some incredible people on my board right now, but I have plans of adding at least 2 more board members before the year end of this year, and hoping to add even more in 2023. But I've been a little bit selective because understanding the first responder population and having a heart for that is really what I want to get behind, want our board members to get behind. but I will diversify that outside of the responders themselves being on our board. But we do have one responder there right now, former responder, and then we have one of my board members is a CFO of a large nonprofit in Denver that serves inner city kids. So he's been able to help with that side of things. And then our other board member has also started nationwide organizations. So there's some good diversity so far.
Yeah, I would just add in that don't reinvent the wheel, right? Like there's a lot of organizations that have figured out how to diversify boards, and it is hard work to diversify a board. So lean on those. That's just my advice, is to lean on those contacts that you have and have them help guide you in some of that process too.
Absolutely. Thank you for that.
Eliberto.
So again, I totally understand that you're a new agency. One of the other parts that staff looks at is we look at your financials and your financial position, and you know, one of the things that I noticed, and I wrote notes as I was evaluating the application, is that, you know, almost 50% of your funding comes from government sources. And I'm just wondering what the plans are to diversify the funding. Just wanted to get that.
That's an awesome question. And it actually comes at the end of, we just ran one of our our largest fundraiser ever 2 days ago. We were able to raise over $100,000 on Saturday. And so early on, and I'll just be as transparent as I can, we had an angel donor. I'll call her that because she's the only reason that I'm doing what I'm able to do in this sense. And so I didn't have to work as hard as probably most nonprofits from the get-go. But now that we're bursting at the seams and I need more help personally, my wife and I can't be the only ones doing this, and we're not anymore. But we're diversifying that with business sponsorships. We've got some incredible businesses that want to support us from an annual and a quarterly basis currently. I've been trying to do a better job of creating a strategic plan that I can show to private donors, and setting up those meetings is becoming crucial. So that's a way that we're starting to bring more money in the door.
Okay, thank you.
Robert.
I'm thinking, you know, first responders, and I'm thinking about registered nurses and teachers. It would seem to me that the first responders need a union, some kind of union organization that could go on strike and get better wages and better conditions. Why isn't it unionized as opposed to you taking it over as a small venue?
So there are unions within agencies. It kind of is agency specific. I know my old fire department they got a union in 2014. So it was about 4 years into my career. And that union really started to fight. Early on, we were making, I think I started at $38,000 a year. But by 2015, we were up to about $65,000 a year because the union had fought for better wages, and better, you know, healthcare, retirement benefits. So it depends on the agency. There are some strong unions within the metro area, but when you look at it from a rural side of things, they're still a little bit behind the times when it comes to the union side of things, and it's mainly because of the size and the volunteer aspect.
The same is true for the private ambulance services.
Yeah,
they don't typically have unions protecting them.
So that begs a question for me, right? So you were a statewide agency. You know, what's the level? You know, the city of Longmont has, of course, it's a public safety, and it's got its own fire department. And so I guess the question I would have is because I don't think I saw it in the application. What's the level of collaboration that you're doing with our public safety department here in Longmont?
So for the fire protection district that serves the city of Longmont is Mountain View Fire. I've been working alongside their union president since probably early 2022 to try to get more and more Mountain View firefighters to understand what we offer and how we can serve them. I'll just bring up one example of a collaborative effort. After the Marshall fire hit, even though that wasn't necessarily in the city of Longmont, you had Longmont responders that responded to the Marshall fire. And what we did is we collaborated with each of the agencies that responded, including Mountain View, including Longmont PD, and we offered wellness services for 2 weeks. So physical therapy, IV therapy, massage therapy, to take care of their physical health. And I'll just say this real fast. The way we view mental health is, I think at times it gets put in a box, but we see it as your family health, your social health, your financial health, your spiritual health, and your physical health comprise your mental health. And those are the services that we provide. And so we collaborate with these agencies to try to bring trainings to their department. I've been to a Longmont Mountain View fire station to roll out to them what we offer. And next, we would like to get into the PD. I just have not been able to make a good contact up there to get us in, but that's another agency that we'd like to get into. And then, as Emily states, the private ambulance sector that's up in that area as well.
And if I could just add that what Jordan's doing is really filling a gap in services. A lot of fire departments and police are still evolving when it comes to mental health awareness among their members. And it used to be very stigmatized to even reach out for mental health, and that's all changing. But that's a relatively new change. And so what Jordan's doing is he's really addressing that gap, and he's bringing awareness around mental health to all these departments as well.
So we got less than a minute left, about 30 seconds.
If there's anything you'd like to add that we haven't touched on, we'd love for you to do that.
I appreciate you guys taking the time and to consider us. I'm grateful for this, especially as new as we are, but I will just stress the importance, just from being in the position that I'm in right now. We need cities and agencies and the public to be educated to support our responders, because at the rate we're losing police officers specifically because of the lack of support, that affects the community as a whole. Because when people pick up that phone to dial 911 and the person on the other end of the phone isn't necessarily competent, or it takes a while for somebody to pick up, that's a problem. And we are really trying to address that. We're trying to keep our responders healthy. And I would love the opportunity to provide more and more services in the city of Longmont as we move forward with your guys' help.
Great. Thank you both for being here. We appreciate your time.
Thank you.
Thank you very much.
Thank you. I always love seeing new agencies. Thank you for submitting.
Thanks.
So our next should be Medicine Horse. They're not in the waiting room yet. So we have about 3 minutes before they're expected.
FYI, my thing says that I can't restart my video because the host has stopped it.
What does that mean?
Oh, there we go.
Sorry.
Okay. I think, no, it's okay. I'm guessing maybe it was with somebody else, and then as they dropped off, it like hit me or something.
Okay.
So no big, we're all good now.
Perfect. Thank you.
I know we did confirm with every agency. I know that Brenda and Erica worked hard to confirm with every agency. So if they don't show up, we're gonna have a long break. We can try and email them, or I don't know who was gonna be here, Brenda, for
So it looks like Emily, who was just on, submitted the application for Medicine Horse as well. She mentioned that she was a contract grant writer. So
Okay.
I think she may come back on for Medicine Horse.
Okay.
Yes.
Because yeah, it's 6:19 and they're not here.
Let me check in with the other contact. And I'm trying to remember her name, but I'll take a quick look.
Oh yeah, Emily's back in the waiting room. Okay.
Okay. And there's one more, but let me see what her name was, or the other person's name. I shouldn't say her. Natalie. Natalie also confirmed that she would be participating.
I thought Natalie was gonna be out of town.
I don't, let me look at the emails.
Okay, I mean, that's fine. If Emily's the person, then that's fine. We can let her in and, you know, we can go with her and, yeah, that's fine. As long as they send somebody, that's what matters.
Okay. Are you ready? Do you want me to go ahead and let
Yeah,
Emily? know
yeah,
and then
6:20. Go ahead and let her in.
Okay.
Hello again.
Hi again, Emily. Are we expecting Natalie to join us?
No, Natalie's out of the country, but Mike Franklin, the board chair, is going to be joining us.
Okay, that's what we were wondering. Does he have the link?
He should. I will send it to him again.
Okay. So this is when we have agencies asking for two different projects, Emily, we want to give them each their 15 minutes of time.
Okay.
That being said, if we get through it, you know, faster, then that's okay too.
Okay. I'm just gonna text him real quick.
And what I
talked to him this morning about this.
Okay. Deanna and Robert and Eliberto, if you're okay with it, what I'd recommend is we do, since we basically have 30 minutes total for the two programs, is that we do a timer for 10 and 10.
Okay.
And then that last 10 minutes, just to make sure that we have time devoted to both. And then that last 10 minutes, we can, you know, if we want to dig in on anything more for either one, we can.
I can do
Does
that.
that work for you as well, Emily?
Yes, absolutely. I'm just sending him the link to multiple emails. Okay. There we go. And you can always start with me. I've been working with Medicine Horse for a really long time, and I've been their primary grant writer for 5 years. So I know the company and agency inside and out. I apologize for Mike's tardiness.
It's no problem. I think, Eliberto, if you want to go ahead and start our timer.
Yeah, I'll go ahead. I'll
fine.
go ahead and get started, and Mike can join us when he can.
And Emily, I think maybe as we start, before we kind of dig into either one of the programs, I'd love if you could give us maybe a quick summary of the two different programs that Medicine Horse is running. I think one is for youth and one is for veterans.
Okay. Yeah, and Medicine Horse runs quite a few more press with that. The youth program is probably the most popular one, and it's comprises about 50% of our participants in programming. So I would say that our youth program, it consists of two different groups. One is called Rainbow Wranglers and one is called Giddy Up. And so Giddy Up is more for at-risk youth, and then the Rainbow Wranglers is specifically for LGBTQ youth. Our Operation Be Heard, which is our other one that we're requesting funding for, is it's a program for veterans, and it's just crazy. And when it first started, they were pretty tentative about coming, but then it's gotten to a point now where the word of mouth has traveled through the VA, and we have wait lists for the veterans programs, which Mike tends to also horse handle for those, so he gets firsthand experience in those.
Hi, everyone. Sorry, I'm a few minutes late.
It's okay. We have some time.
Deanna or Robert or Eliberto, any of you have questions that you want to start us off with? Eliberto.
Yeah, I can go first. So one, I mean, thank you for the application. I'd just like to dig a little bit deeper into, you know, question number one around the agency piece is really, we love to hear or read about what strategic goals the agency has. And I'd love to learn a little bit more about what strategically are you thinking. I know that there was conversations about expanding or finding a new site. So I'd love to get a little more information on your strategic goals, you know, for the agency.
Perfect. Mike, do you want to talk to that?
Sure, I'd be happy to. Thanks for the question, Alberto. Yeah, as a matter of fact, we just signed, and about 2 weeks ago, we signed a lease on a new facility that we'll be moving into early December, that is on Kenny Ryan Road, just north of 52 on the Boulder County side. So a little closer to Longmont, and more room for us, the ability to really have control of our own space. So where we are now, it's a beautiful space. I mean, really, if you were to come out there, the views, everything is just spectacular. But we're sharing it with the boarding facility, and that doesn't always work out the best. They have their schedules, we have our schedules. So where we are now, we have the entire facility give us room to have more of our own horses, which gives us the ability to have more of our own programs. So we are really looking at a kind of a measured growth over the next couple of years. We're not trying to triple or quadruple next year or anything like that, but we really hope to expand 30-40% a year over the next couple of years. We think the demand is there. We know the demand is there for the services, and so excited for that. Honestly, and excited to be a little bit closer to maybe where we have some additional folks we can serve in the Longmont, closer to Longmont.
So I had the benefit of, we do meetings with board members with various agencies through the year, just to kind of, so we can dig in more outside of the grant funding process. And I had the opportunity to meet with Natalie a little bit, I think before everything was finalized with the new location. I'd love either Mike or Emily, if you could share, I got to hear a little bit about why equine therapy, but I think it's helpful for others to hear of like, what's the benefit of this? Like why, the cost of providing services with equine therapy, per person or per participant, per patient, however you want to refer to it, it can look significantly higher, right? You've got like care and maintenance of an animal, you've got stables, you've got barns, like all of these things. But how does this differ from, sort of our traditional mental health care model, and why does it matter?
Do you mind if I speak to that a little bit, Mike?
Not at all. Go ahead, Emily.
I have a background in public health research, so I've been putting together those evaluations for medicine horse for several years. And one thing that is really backed by evidence and research nationwide is that equine therapy and animal assisted therapies really reach the folks that can't be reached in any other type of therapy. So like in cognitive behavioral therapy or talk therapy, for some reason, working with a herd and working with a therapist with a horse, to have that buffer there, a lot more work gets done. We had one veteran who said he got more out of 8 weeks than he did 40 years of individual therapy. So go ahead. I know you have a question. You just raised your hand.
Well, I just wanted to actually check with Caitlin. Are we looking, so because we have these two programs they're applying for, are we talking about the veterans first or the youth at risk first? You're on mute.
I could probably answer that question and separate it out.
We've been talking about veterans, which is fine. So but we have 10 minutes for each program. So that's what I was wondering.
I don't think we can't hear her.
Caitlin, you're muted.
Caitlin, you're on mute.
Oh, sorry about that. I totally threw that out the window and was not paying attention to my own suggestion with the question that really was about both programs. So I apologize. I don't know if you want to dig more into that, Emily, and then we can dive deeper into both of the programs.
Yeah, no, so there's a lot of research coming out and evidence that's showing that equine assisted therapy is really making a much bigger, more meaningful impact for folks where other modalities have failed. And those are the folks that typically are the ones coming to us, are the ones that have tried other treatment options and they just haven't been successful with their mental health. And our therapists working with the horses, it kind of creates a buffer so that they can be grooming and touching the horse and talking to the therapist at the same time, but there's a lot more that just comes out, and the horses will also, they're very, how do I say it? We call it empathetic, but in reality, what it is they live in that fight or flight zone, in that present awareness. And so whatever a client is coming to us, and when they are coming to a therapy session, whatever they're experiencing in their body, anxiety, fear, joy, the horse is going to recognize that and is going to reflect that back. So they're going to really see how they show up in the world when they're around horses. And then the therapist really is the one that's just guiding their observations and their understanding of what they're going through. Mike, did you want to add on to that?
No, I would only just tack on that you alluded to is that different modalities work for different people. And so, there is a segment for whom animals work great, and sometimes that's a dog and sometimes that's a horse. And again, I would just say I've experienced just in helping out on the sessions as a horse handler, some of the interactions, and it's quite amazing when people connect to the horse and are able to kind of release some of their fears and anxieties, and learn that they can put a halter on a 1,400-pound horse and lead it around an arena, and it'll follow them and do what it wants. It's really powerful.
And just to speak to that, I know we don't have a lot of time, but I wanted to let you know that we are evaluating every single group with evidence-based measures. And we do have plans, hopefully in 2023, to write for an NIH grant so that we can see the true difference that the impact of equine-assisted therapy versus traditional talk therapy.
Great. So since we do have two different programs, I want to give an opportunity to dig in on one of them. Let's start with the veterans, since we've kind of touched on that a little bit more. Deanna or Robert, do either of you have questions specifically about the programs specifically targeted toward veterans? Deanna.
I guess I'm just wondering how you're reaching your clients or your customers. I'm not sure what's your preferred term for the people that you're serving, but how you're reaching the veterans. Are you working directly with the VA? Are you working with various organizations to get those referrals? Just maybe you could give us a little information about how you get the people that come to you.
We have a partnership with the Boulder VA. And so I believe most of them do come from, do refer from the Boulder VA. And then a lot of it has been word of mouth, because these veterans are going home and realizing how meaningful this has been, and they're going and they're telling their friends about it. And so that's been a big piece. But we also advertise for it on social media and on our website.
Go ahead, Deanna.
Just so a follow-up question for that. I didn't notice it in the application. I might have missed it, but have you tracked in terms of numbers of veterans that are in the Longmont area? Have you tracked that?
So we've been tracking zip codes. And so I do believe I had the number of individuals from the Longmont area in the application. I can look at that again, but I don't have that
If
number.
you put it in, I can find it. I just probably missed it. It's a big application, so
yeah,
yes,
and we're making,
you
as we are moving closer to Longmont, we are trying to make projections, because we would like to reach out to and do more outreach in Longmont and serve more citizens of Longmont.
Thank you.
Yeah, there's a veterans organizations in Longmont. We've worked with Boulder because they specialize in trauma and PTSD, but there's a whole range of other veterans that are out there that we can reach through organizations in Longmont, as well as other parts of East Boulder County as well. And want to, really hope to be able to do that with more room to grow.
So we've hit our 10-minute mark, Caitlin. So I'm gonna start the next 10-minute, and we can focus on the youth at risk. But I do have a question about their board.
Go forth.
So, like I said, so staff and board look at different aspects of the application for our evaluation portions, right? So we score different parts of it. And the staff really looks at your financials, which, by the way, they look good. I look at what you provide. And then I also look at your diversity. And I know that this has been a challenge for Medicine Horse. And so I was glad to see that you have a newer person on the board and a person of color. And so I guess the question is, what's the plan to grow on that success and to continue to diversify more?
Yeah, I mean, I think we recognize that. We have been working on it. We can continue to work on it. Sometimes it's hard just to tell from pictures, but we do have a woman on the board whose family's from Mexico. So we do have some diversity in other areas as well, LGBT community as well. And so, it's a goal of ours. We're trying. It's a process. What we'd really love to be able to find is somebody with a therapeutic background who's from a marginalized community or disadvantaged community. I think that would be really helpful for us. And so it's high on our list of objectives for the coming year. It's been high in 22 and 2021 as well, and we're making progress. And we just hope to continue making progress as well.
And just to speak to that, one of our therapists speaks Spanish conversationally, but we would love to bring on a therapist that speaks Spanish as a first language to really work with this Latina communities that we're starting to work more with, especially through our partnerships with the Thorn Nature Group. So.
Yeah, that was another question I had. Your youth at risk program, can you talk about their demographics and who you're projecting to serve?
Yeah, so, and Mike, you can jump in and correct me if I'm incorrect on any of this, but my understanding from the Youth at Risk program, because I do a lot of the work virtually and remotely, I'm not there on site, is that these are youth that are at risk for truancy, drug abuse, substance abuse for one reason or another. So perhaps from a single parent household, a low income household, or belong to a minority community like the Latina community. But all of the youth at risk in our Giddy Up program are youth that are specifically at risk for just developing poor health behaviors and stuff like suicide, depression, and anxiety. So we're trying to reach them. And then as far as the Giddy Up, those are all youth that have already determined their gender. Although we do have another group, we used to have another group that was for youth that were questioning their gender identity, but I think that the Rainbow Wranglers now is specifically for youth that are transgender or LGBTQ. But as far as income level goes, I'd have to look at that, but I know that most of our at-risk youth are in the lower income levels.
Yeah, that's our goal. And I think one of the other things we've been able to do is we have a scholarship fund. We were fortunate enough, actually during COVID, to get incredible support from the cities in the county in this area to help us. And so we created a scholarship fund, and that's allowed us to funnel some of the at-risk youth after they finished the group therapy sessions to some of our therapists who are able to offer them individual therapy clients that sessions that we pay for out of some of those scholarship funds. So we think that's a real valuable add-on as well. So it doesn't just end after 6 or 8 weeks or whatever it is.
One of the things I noticed in the application for the youth one is that, and I think, Mike, you mentioned not necessarily growing, 200% next year. You're moving into a new location, you've got a lot going on. But I did see that one specific thing was that in 2023, adding a group specifically for BIPOC youth. And I wonder if you could tell us a little bit about what your plans are for that and what sort of brought you to doing that.
Yeah, that's Natalie's baby. So it's through her partnerships that she's developed over the last year or so with the different communities. We've been bringing up Outdoor Afro, mental health partners, and the Thorn Nature Group, and really finding that there's a lot of interest with BIPOC community. And so she's really hoping to be able to add that specifically in 2023. We just haven't had the funding for it yet. And Mike, do you have anything you want to add about that?
Yeah, just another quick add-on to there is we did a whole series of DEI sessions over the summer. One of our board members, Clara Smith, is the woman I was referencing whose family is from Mexico. She's a DEI coordinator at CU. And so she led the whole board and some of the staff through an 8-part DEI session. And one of the things we talked about was land acknowledgements. And the fact that it's not just enough to say, oh, hey, this land used to belong to a certain group, wherever it is, or Arapahoe or whatever. And so we wanted to try and find a group of natives, of indigenous people that we can offer a program too. And so we're out there trying to find a group. Natalie's found a organization down in Denver that we hope can bring us a group of kids for that. I think that would just be incredible between our location out on the plains and the horses. Being able to have a group of kids like that would, I think, be really powerful way for them to connect with their heritage. But some of those things kind of take a while to get established and get the right contacts made. So we're actively trying to do that one. Don't have anything set in stone yet, though.
Other questions, Deanna or Robert?
So I have one more financial question. And Emily, maybe you can help me with this. So again, I looked at your financials, but I don't think I saw a balance sheet. I just saw your P&L for 2021. So yeah, so if you could send me that. I mean, 2021 looked good. I wrote notes. But just would love to see the balance sheet for 2021.
Okay.
You know, best practices in the nonprofits is to have about 3 months in reserves. And I wrote here that I did the math about what your operational costs are. You almost have a year in reserve. So I guess the question is, what's the plan with that?
Well, I can speak to that a little bit, Emily. One of the goals of this coming year also will be to possibly create a long-term capital campaign that we can seed with some of those funds. Again, we were very fortunate during COVID. PPP loans, EIDL loans, grants from different organizations that really improved our balance sheet. And so, yeah, you look at that and think, well, there's no reason just to sit on that money. We could be using it for more programs. That's true. We are, again, we've been a little hemmed in, so we've only had so much we can do in more programs. So part of that also is then to set some of that aside for a capital campaign in the event that someday we can afford a property of our own in Boulder County, as challenging as that can be in Boulder County, as I'm sure you're aware. So does that help?
Yeah, thank you. And we have about 2 minutes left, Caitlin, of the 10-minute mark. So
Okay. Which means we actually still have about 10 minutes total for across the programs. And so with that said, I don't know if Robert or Deanna, if you have any questions, I think we're okay to transition questions about either program specifically or about the agency as a whole. Okay. Eliberto, did you have any other questions?
no, I'm good.
Okay. With that said, if either of you have anything you'd like to add about either of the programs or the agency, we'd love to hear, if there's anything you think we haven't touched on or that you think would be important for us to be considering as part of your application.
Yeah, one of the things that Emily and I talked a little bit about earlier this morning about the call was that I've been fortunate enough to have a good friend who's involved in the CASA organization, the Court-Appointed Special Advocates, and she sponsors a young gal who was really in need of therapy and actually paid for her to have therapy at Medicine Horse, and it's going great. And she loves my horse, so that's all fun too. And that's one of those programs that I think really is going to get our target population in. So what we're trying to do is do more partnerships like that and go to CASA and organizations and say, bring us people for these groups. It's hard for us just to put a thing on our website or send out an email or social media. We need partners. And I think that kind of partnership is just absolutely the perfect kind of one for us to identify, particularly youth who are in need. And I think we'll find a number of those in the Longmont area and East Boulder County in general.
Yeah, and then I'd also like to say, oh, go ahead if you have a question. Go ahead.
Go ahead, Deanna.
So since we had a few extra minutes, I thought I'd just toss in my own plug here too, that I was a foster parent for several years. I just closed my license, but I was a foster parent to a lot of different kids that really would have benefited. And we worked, pretty closely with CASAs on the kids that came through our house too. So I don't know if you've explored reaching out to Boulder County Human Services as they're placing kids in foster care, but they can secure funding for things like that. That might be a good contact point for you guys too. And I know there are several foster parents in our foster parent group that have talked about using equine therapy, and it is recommended a lot by trauma specialists. So for sure, that's something that would really serve kids in foster care very well. And there's a lot of LGBTQ kids in foster care too. So there's a lot of crossover possibility there for your program. So
Yeah,
Do
that's
you
that's
have,
the exact kind of information we need to know,
Yeah.
and the partnerships. So yeah, thanks.
If you have a specific information on the foster parent group, you can give them our contact info and we can set up a meeting.
yeah,
Or
I would love to connect you guys.
something,
Yeah,
we can set up a
definitely.
meeting.
Okay.
Okay,
Um,
okay. And we have what, 5 minutes?
Yeah, I was gonna, I'll throw in as well that I will connect you as well to someone. I know someone who is actually starting a 4-H group specifically for gender diverse kids and neurodivergent kids specifically. And I know that this is an area where folks, so I'd be happy to connect you with them because there's this gap, right? Like where folks sometimes need separate space to process and feel included. So sorry to interrupt, Emily.
Oh, that's okay. I just wanted to mention that equine therapy, there's always been this talk about it feeling like magic because it does create such an incredible impact in people's lives. And a lot of the evidence has been anecdotal, but we're getting to a point now where the research is really starting to back how incredible this work can be, especially for LGBTQ youth. Those have been our highest population, I would say, even since we were founded back in 1999. The LGBTQ youth population has been a really big part of who we serve and has really benefited from it. So we have a lot of plans. Hopefully we can achieve most of them, but we have a lot of plans to do some actual research and some scientific research around equine therapy so we can bring more light to it, just to our state, but also nationwide. So.
And Caitlin, since you mentioned 4-H, our hope is to have more than just horses on the property. We hope to have some goats and donkeys and burros and things like that, because it's all helpful, and people attach themselves to all kinds of different animals. So we want to be as broad a spectrum as we can be.
It's very true. I have a little one who, just when we go to the farm with where our friends are that have a goat, they have 2 goats, they have chickens, they have horses and a snake, which is not my thing, but like he's learning to, like, he's 7 and he's learning to actually like control his breathing and be around the animals so that they don't scare. And it's much easier to convince him to do that for an animal than for another human, right? Like, mom asking him to chill out doesn't have the same impact as like, hey, the horse is scared and you can see it in these ways, so it's even just with like not even the therapy aspect, it's impressive to see how differently kids and others respond when there's animals involved. So
yeah, and I have a 7-year-old and I completely agree.
So we do have a couple more minutes if there's any final questions. Otherwise, thank you both so much for your time tonight. We really appreciate it and hope you have a good rest of your evening.
Thanks.
Thank you.
Likewise. Thanks for the time.
I'll send that balance sheet over.
Thank you.
Okay, thank you.
Bye-bye.
All right, so we got about a 10-minute break. Yeah, those happen sometime.
I'm gonna do my bio break now.
All right, I'll see you guys in about 10 minutes. Wait, do you have a question, Robert? Sorry, you're on mute. I can't hear you. You're on mute.
Okay,
go.
I owned 2 horses for 20 years,
Oh, wow.
a ranch up on Magnolia Road.
Okay.
For me, it's very hard to see horses as therapeutic because I just see them. I enjoyed the horses. I had fun with the horses, but I also like dressing up with the cowboy boots and the Grover's coat and the hats and all that. Yeah, I'm just saying it was pleasant, but it was terribly expensive to own 2 horses.
Right.
With all fees and all that. And you wonder, wouldn't a dog be cheaper than keeping 2 horses? That kind of thing. I
Right.
never felt that owning a horse was therapeutic for me. It was obligation. It was riding in the mountains. It was a bunch of things. But, I never could say, all I saw was obligation, duty, 24/7. You couldn't leave them, And I guess somehow if you own a horse like I did, a horse is a different thing than something therapeutic. And it's hard for me to make that jump between what I think of horses or what cowboys think of horses as tools, to do something.
Right.
And
No, I had a horse when I was growing up.
did you?
Yeah, we still have a ranch. I don't have the horse anymore. We've gone the motorized route, just easier to keep and maintain than a horse. So you get around.
I figured it cost me. It would have been cheaper to own a Rolls Royce than to have those 2 horses.
Yeah. Oh,
with hay, with shoes and veterinarians and
Yeah. So, but that being said, again, the folks that they're working with don't have to take care of the horses. It's at youth risk. It's veterans that are coming
Yeah.
and enjoying the horse. So maybe as an owner, it might not be therapeutic, but maybe as someone who is just coming to the farm to see the horse or the horse ranch. Yeah.
Do you feel like I do, having owned a horse?
Well, I didn't own it for that long. I didn't,
around him, but I didn't feel like.
Yeah, I mean, I don't know. We didn't own the horse for that long. Like I said, we went motorized with the motorized. First we had a ATV, and then we got a bigger type of vehicle, an APV. But it was fun having it. I wouldn't call it therapeutic, but definitely fun having it when I had it. We have I'll tell you what though, I have chickens now. We just got, we got a permit for chickens, and we have chickens, and and these chickens are unlike when we had chickens growing up when I was at the ranch too. And these chickens though are different. Like I get to hold these chickens. When I was growing up, I mean, they were chickens. We didn't touch them until we killed them. We didn't.
When we ate them, yeah. Well,
so I just fed them.
When I was a kid growing up, we had chickens and ducks and
the same. Well, we had chickens and turkeys. But now, and like I said, I'll sit out in the backyard and have a chicken on my lap and pet it. So I can see the therapeutic piece now.
I can see that some people, if you didn't own one.
Yeah.
And
So
you
again,
just
I think same thing with the
them
horses
and
thing. I mean, if you didn't have to take care of it and you just come and spend time with it, I can see the therapeutic piece of that.
I can see it working. I'm just saying that it's hard for me, for.
Yeah, no, I get it. If you're a horse
to see the
owner, you gotta
horse
take
is something
yeah.
that would improve my life or something.
Right. If you gotta take care of it, pay for its boarding and all that kind of stuff, I can see that. But if you don't, if you're a kid that just maybe has never seen a horse in live before, you show up and this huge animal that can be scary and gentle at the same time. I mean, it could be life-changing, I think.
And there's also the fact that
in other places they use ATVs anymore. A horse is too damn much trouble.
Yeah.
the saddle, the cape, and an ATV, you just jump on it, start it, and away you go.
Yeah, exactly. What were you gonna say, Caitlin?
Hurting itself or you being hurt or anything like that.
Right,
I'm
right.
just saying that, things are, it depends on how the horse, whether you live with it, whether you,
Right,
and whether you just walk in to see a horse.
exactly. Yeah, totally. I get that.
I knew some young woman, by the way, the majority of horses are owned by young women. Did you know that? I mean,
did
they're
not know.
paid for them, but they're basically owned by or rode by young women, at least in this part of Colorado anyway.
Yeah, I don't know. I mean, in Texas, everybody had a horse. It's like it didn't matter.
Yeah. I was talking to the farrier and he was saying that it was unusual to have a man that owned a horse, and took care of it other than to ride it and not just be a parent for your daughters, to have a horse, that kind of thing.
Yeah.
Yeah. But then the parent does all the mucking, does all the hay.
That's what I'm finding with the chickens. My wife does a lot. I do a lot. The kids enjoy the chickens, and we do a lot of the work. I
Yeah.
think that's any parent's role with pets. Is like kids will say, "Yeah, get me the dog. I'll pick up poop. I'll feed them. I'll do this." And next thing you know, you're picking up poop and making sure they're fed on a regular basis. I think that's across the board parents and kid relationship in their animals.
Yeah. Anyway, it's interesting. I would never have thought of a horse as something I
So
could.
you know who hasn't applied to us?
I could use therapeutically, and I fought. I was in Vietnam. I'm a war veteran. And horses never.
Yeah. No. Again, I think this is new. This is new science, right? I guess.
Yeah.
I mean, I think so. I just like going back a little. I think some of it is also like, I think despite where we live, there's a lot of kids who don't have animals or have access to like farms, and even the caretaking parts of it in many ways can be novel. So in the sense of like, if you are in a let's say you are in a family situation that was potentially traumatic in some way, like an animal that you can care for and that you can be responsible for, even like in a small context, can be huge in the sense of like, if I think about like a preteen or a teenager who is struggling with like self-esteem and feeling like worthy or like they have something to offer, the fact that like you can feed an animal and like brush it and like care for it in some even small way can actually be really empowering, particularly if you have been disempowered in home or in school, or you're not doing well in school. And so like you check out, whereas this is something where maybe you can come in and be successful at something that you haven't been before, even if it's not like the full gamut of like caring for or owning like one of these animals. Like the fact that like I made sure this horse was brushed today, and like when you can't care for yourself, sometimes caring for someone else or an animal can be really incredibly powerful.
Yeah, I agree. I think that's true. For kids that don't have it and then they get to do it. I remember my cousins that come down from Indiana who didn't get to see the animals all the time. They were even my kids, when we go down to the ranch, they don't get to see the cows all the time. So when they're in the corral with the cows and they get to brush the calves, and they get so excited just because, I had to do it. I hated doing it because I had to do it. But if you don't have that access to it and you do it, it's really, yeah. So we got about 2 minutes before Mental Health Partners comes up. So I'm getting dinner delivered. So
Go get a cup of coffee.
yeah, I might be off camera sometime, I think, because I'm getting dinner delivered here in a bit. If we were in person, typically we have dinner at the meeting beforehand. But the nice thing is we can all be in our homes and do it from home. But it also means that we have a 4-hour night. So I was talking to Erica, like, that's such a long time.
Yeah, when I looked at the schedule, I was like, four, that's not a typo, 4 hours.
4-hour long meeting. So totally understand if you go off camera, if you're eating or something, totally get it.
I was totally eating a slice of leftover pizza during the last one, which is why I kept going off camera.
Yeah.
And now I have full of vegetables, so I'm like evening it out.
Yeah, and we can just let the agencies know that that's what's happening, that we have a, it's long meeting and people
4
are going to be
hours,
going.
right.
Yeah. So, we'll see about next year. Maybe we have extra nights and less time. Maybe that's something to think about as a board.
Yeah, I mean, it's like I said at the beginning of this, there's always benefits and detriments to every choice you make, right? Like, it's great to get it all knocked out. It's like one night where my husband's on kid duty. I mean, not that we don't, anyway, yes, that he can take over. It's easier if he doesn't have to do that multiple nights, right? So
yeah. So
Yeah.
these are things that we'll learn as we go. Just 4 hours is like, oh my God. I mean, we've done 4-hour mornings. I know a Saturday morning we went from 8 to noon, but a morning is different than a night, right?
Yeah. I know I lose steam. Was thinking I should have bought some Red Bull. I hate that stuff, but it works.
I was gonna drink some coffee, but if I have it anytime afternoon, I can't sleep.
I know, that's the downside.
I'm like,
So
Yeah.
I'm curious, being the new person, do you ever do meetings during the day? Like,
People work. It's hard. We have, but it's hard to. You would have to, because people are at work and stuff. So
we'll do a save the date.
yeah, no, we have done them. We've done like 9 o'clock on a Tuesday one time. I remember.
I mean,
I was gonna say last
doing
year
them
we
on the
did
weekends.
several.
Yeah, and we've
Yeah.
done weekends too.
Mm-hmm. Which is hard too for different reasons, right?
Like
we're not
for me, it's hard
but-
because I'm
yeah.
always coaching football, and so that's when we
Mhm.
play.
Yep.
All right, so it looks like mental health partners here at 7 o'clock. We can go ahead and get them started.
Robert is not here.
That's okay. He'll come back soon. Make sure that folks can hear us well.
Hi, Kate. Hi, Katie.
Just want to make sure that Kate, you're from MHP, right?
I am, and so is Katie. It's like
All right,
the
good.
Kate, it's like the Kate show.
So, sometimes people show up early, so just want to make sure that we got the right folks. If not, we just ask you to go back to the waiting room.
Yeah, I think we're just waiting on one more. I think Sarah Reed.
Okay, we're waiting on one more. Okay.
Yep.
If you want to start the explanation, Caitlin, Sarah's done this before, so.
Okay, great. And Kate, you look familiar. Maybe I can't remember. Maybe you were here last year. I'm not sure, but
I was not here last year. I'm the
Okay.
I'm the VP of clinical care, so I'm the COO at MHP.
Okay, well, welcome. I am Caitlin Abbott. I am the chair of the Longmont Housing and Human Services Advisory Board. And with me tonight, although is Deanna and then Robert, who is not on screen right now, but will be back shortly, are both members of our board. And then Eliberto is on staff. For those of you who have observed or know about these meetings, in the past, we have had as many members of the board as we can possibly fit, sometimes having up to 10 folks on the call. This year, we have actually split it up, and every board member has 2 to 3 focus areas that we're zeroing in on. So we have fewer applications to evaluate, and we can go a little bit deeper with some of the agencies and programs that we're evaluating. So that is why you have, a small cohort of us here. Each agency for these hearings gets 15 minutes, and Eliberto will be our timekeeper when we start. And the way it typically works is that we will start with questions from the board and staff. And then if we have any time at the end, we'll give you an opportunity to share something that maybe we missed or we didn't zero in on, or something, that you'd like us to know. Quick heads up that we do try to keep really close to the time, but we also have a very long evening tonight. So you may see some folks coming on and off camera as it's dinner time, dinner delivery time and so forth, but we are here and engaged. And so just wanted to let you know that is a possibility. We try not to chew in front of you as much as possible or that sort of thing. So with that, I think you said we might be waiting on Sarah. I think we should go ahead and get started to make sure you get your 15 minutes. And then if Sarah comes, I think Brenda can let her in when she arrives. Okay. And with that, Eliberto, are you good to start the timer? All right. And then Deanna, if you want to kick us off with a question.
Sure. So I had a question. It looked like you have a pretty significant, well, I guess it's not hugely significant. It's only 2% of your budget, but you have a shortfall this year projected of 1.3 million, which seemed like a lot to me. I understand it's only 2% of your overall budget. Is that outside the realm of sort of what you're used to dealing with in terms of your budget on an annual basis? If it's not normal, do you have any plans for how you're going to address that going forward in the future?
Yes, it's not normal. And based on where we are currently, Deanna, just with workforce and other things, we needed to invest in our workforce. So we utilized some ARPA dollars, and we also know that we're at a deficit. And the hope is that as we get more workforce in here, it's sustainable because we would be generating more revenue. So we took that risk. With our eyes wide open, just with the landscape of where we are, and we're doing some advocating on some other contracts and other things to help compensate for that loss.
Can you expand a little bit on what you mean in terms of investing in the workforce? What does that look like for mental health partners?
So we increased salaries by 18% this year. I mean, some of that was budget, some of that was bonuses, so like a one time, and others was an investment into the salaries so that we could be, we're still not competitive, but so we could be competitive with the private market, especially with licensed clinicians. We also established a loan repayment program, and most of that is through ARPA dollars. We did service years, so monetary bonuses for service years being here. So we wanted some retention pieces, not just pieces coming in. And that has been well received. And when all those things were put into place, we have seen an uptick. So we were at 80 vacancies. We're currently at 62, but there's some revolving pieces, and we had over 200 applicants in the month of August, and we're seeing that we're able to staff these programs. We're still struggling somewhat with licensed clinicians. That's the hardest thing, but the good news is prescribers, psychiatric providers is what I'm supposed to call them. Psychiatric providers are banging down our door. And coming in. And so we're hoping that people will come in and embrace the mission. We also have seen a lot of folks that have left that have come back because they are really mission work, and the grass is always greener, right? So I don't know if that helps, Caitlin, or if you want me to elaborate even further.
No, that's great. Yeah, because I think that last year during the application process, that was a big risk that was identified as part of the application, is that, staff turnover, and with the pandemic, there was just a lot. And it was something we heard across our agency partners, that retaining staff was difficult in the context of where things were. So, yeah. Eliberto, I think you had your hand up, so I'll let you go with a question.
Yeah, so just so you know, so when we review these applications, the board reviews certain aspects of the application, and staff reviews certain aspects of the application. And sometimes they overlap, but sometimes they're different. One of the things that staff reviews is really board diversity and inclusivity. And I know you've all been working on that. And at the same time, I know it's been a challenge. So I'd like to hear an update. I think you have one person of color on the board right now, and maybe that has changed as you've turned in the application, but I'd love to hear more about the work that you're doing on that.
Yeah, we hired Sarah D. Anderson, who's our VP of Justice, Equity, Diversion, and Diversity and Inclusion. Sorry. She was hired last September. So she just hit her year anniversary. And she is doing some work with an employee council to help with hiring folks with diversity. We're losing 2 members of our board, so there's some opportunity there, as well as we are contracting with a consultant agency called Groundswell that is also working with our board, our executive team and our senior leadership team around diversity. So that is going to be one of the focuses, especially with those 2 spots that are open. And it is major work that is going on right now with the board, executive and senior leadership.
Thanks.
And then if nobody, I have a follow-up question based on Deanna's piece too. So can you help me explain? So to Deanna's point, you have a loss. I guess the question that I also had that I couldn't understand was your reserve policy. How does that work?
Our reserve policy?
Well, or lack thereof, I guess.
Oh, well, we do have reserves. So we are regulated or mandated to have 90 days cash on hand, and we do have that.
Okay.
So the loss is not in relation to our reserves, and we actually have a little bit more than that, and we're trying to do some investments. The other reason that we do have a loss is we've taken cuts at the county, and we're taking cuts with Medicaid. So with COVID, there was a lot of membership with Medicaid, and we're going to see a gradual. At first, we thought it was going to be a big cliff, like all these people that got Medicaid all of a sudden aren't going to get Medicaid, but we're seeing it more gradually. And so we also projected those losses within our budget, because the way we get paid is capitated. It's not a fee for service. And so it's based on the number of members that are allocated to our region's Medicaid. And that number is projected to go down about 20%, if not even 30%. So we did a more conservative. So some of these are projections that we don't know if they're going to come to fruition or not.
Kaden, do you have questions? I have another one.
Well, I wanted to dig in a little bit on, so I saw some of the Colorado and Boulder County data in increase in suicidal ideation, mental health issues over 2021 in particular. I'm curious, I know that you all do some tracking of outcomes, you know, obviously aggregated. I'm curious if we saw similar increases among your patient population, or if you found that was that because folks were continuing to receive services, some of those folks were continuing to receive services, if it was more stable. I guess I know it's hard to maybe disambiguate, but I guess I'm trying to understand whether like continuing to receive, like having a mental health, did that positively impact the patient population, or was it just like the world was, to put it bluntly, a shit show?
The world is a shit show, and so we monitor a bunch of different things. So we monitor our crisis services. We've seen a huge uptick, in particular with adolescents, 16 to 18, a 300% increase of folks coming in to our crisis center. We also track suicides. They're called critical incidents, and we have a procedure that anytime there is a suicide or an attempted suicide, we review those, and we report them to the state, and we talk through those. The other thing that we are doing that I think is really helping is zero suicide. So it's pathways. So Longmont actually was our pilot team to do this. And it's really you know, when you work with this population, it's easy to minimize in some ways because it becomes normal. And zero suicide is really an evidence-based practice that helps us really figure out these triggers and these flags and do some pathways of care. and different interventions that we can do. I don't have Caitlin's specific numbers in front of me. I think we are seeing higher acute, and I don't even think, I know we're seeing higher acuity and higher needs throughout. And our interventions tend to help that. Now, whether that, you know, interferes with somebody committing suicide, I can't answer to that. The other thing that we are rolling out this year is what's called risk stratification. And it's really looking at acuity levels and pathways of care to be sure that we have the right people providing the right services for this and managing some of those caseloads. And so that's coming out this year, and I will have the data for you next time we talk.
Yeah, I mean, what I can say is we're monitoring it on a monthly basis. I do think that by initiating the zero suicide and pathways, we're screening a lot more stringently for any indicators of you know, current or potential or even past suicide ideation. And we're getting folks connected directly with therapists who've been trained in specific suicide prevention interventions. And we're tracking how long they've been in the pathway and how many hospitalizations have they had and if those have decreased. And so we're monitoring that on a monthly basis.
And that zero suicide is a newish program that you all are implementing?
For us, it's been around for a little while, but we've been piloting it for a good year and a half. We've fully implemented it a few months ago.
Yeah.
And we're gonna eventually roll it out to the entire organization.
Yeah, that is part of the strategic plan for this year, is to finish out the rollout for other teams. Longmont was our pilot. There's a lot of extra steps and parts and pieces to it, which is super important. Is just figuring out how to do that in the most efficient way and the best client care.
Got it.
So
it's interesting to hear of new things that are being rolled out, you know, like I feel like the area of mental health is constantly evolving, but it can be hard to roll out new things and start collecting the data. So I appreciate that, that you all have piloted that and are collecting data to see where that takes. So Eliberto.
yeah, so I sit on multiple committees throughout the county. I know there's a lot of behavioral health stuff going on right now. We got the opioid dollars. We got, I mean, there's ARPA dollars from the huge ARPA dollars from the county. I guess the question I would ask is, you know, I heard the 62 vacancies, the challenge to get the licensed providers. How, you know, with all of this funding coming in, these resources being added, what do you think the bottom line is for, you know, your potential clients? You know, is that going to reduce? And I don't know what your wait times are now. Is that going to reduce your wait time to actually get in and see someone? What are your expectations, or what are your strategic goals around those areas about?
We actually monitor that, Alberto, and we are at 98% getting folks in within 7 days.
Okay.
So we do monitor that. I know that there are stories, situations, other things that come to you all, and the folks that we see are pretty complex. So you know, navigating the system is hard, I think, sometimes, but we do monitor that. And last month we were at 98%, and we've never fallen below 95% of getting folks in within that 7 days.
Okay.
And yes, we always challenge ourselves to do better, and to figure out where those gaps are and figure out where we can get folks in. So we're constantly looking at that data. We look at from first phone call to assessment to first appointment to second appointment to third. And we hit all our targets with that. And I know there's that person or a person that doesn't get in. And there's always more to that story. And regardless, we need to fix that as well.
So we got about 30 seconds left, Caitlin.
Oh, it went so quickly. If you all have anything you'd like to add for the board, for us to consider as we're evaluating the application and moving forward, we'd love to hear that.
I mean, what I would share is that, you know, we are the experts when it comes to the social determinants of health, and we're able to do those wraparound services and really help those folks that are high acuity. There's other folks in the community who can serve the low acuity, and fine, go for it. And that's something that we're looking at, is who MHP is and who we want to be, especially with Behavioral Health Administration coming in and some of these changes. And I just think that's important to know, because I think being in the community mental health center, several folks come to us wanting everything and anything. And that does impact clients, and some of the clients that have that high acuity where we have that special skill set. And so we are trying to navigate that. A lot of, Alberto, as you talked about, a lot of changes coming with the Behavioral Health Administration. There's going to be another Ray bid coming. And so we continue to try to be innovative and try to serve the needs of those folks and use the skills that we have, and where we are the specialty providers, and we're going to serve those folks that others don't want to serve. And so if there's others that want to serve certain populations, like, go for it, because it opens our doors to serve those high acuity. So Katie, I don't know if there's anything you would add. That's my soapbox.
No, I mean, I just think, you know, over this past year, our team, especially in Longmont, have done a fantastic job of meeting the needs and really respecting client choice. And, you know, I think that's reflected in some of the data that we've collected around face-to-face appointments. And we've increased, you know, depending on the team, up to 50%. You know, versus, you know, telehealth or televideo, because that's really what, you know, individuals are wanting, is that social connection. And so we're trying to do our best to provide that at every opportunity.
Awesome. We are at 7:20. So
Thank you
Well,
both so much for your time.
thank you,
We
guys.
really
All right.
appreciate it.
Thank you.
Yeah, thank you, guys. Let me know if you have other questions, and enjoy your night. Sorry it's so
Yep.
long. I hope you get through it.
Yeah.
Thank you.
Thank you.
thank you.
Take care. Bye.
Have a good night. All right, so you got queer asterisk awaiting as well. So they're in the queue.
All right, are you ready? Do you want me to go ahead? Okay.
Yeah. Make sure that they can hear us and see us.
Yes.
Okay.
Hi, Chris or
There we go.
Maddie.
Yes. Hi there. Yeah, I use both Chris and Maddie, so either one's good.
Okay.
Yeah.
Fantastic. And I know your name, but I don't know it. I recognize you from the hearings last year. So I apologize. Hi, Soren. Nice to see you both. I am Caitlin Abbott. I am the chair this year for the Housing and Human Services Advisory Board for the City of Longmont. We've got Deanna and Robert here also from the board, as well as Eliberto from staff, the City of Longmont. Since you all have been here before, you will notice that we likely have fewer people on this call than we did last year, and that is intentional. So the board has actually split all of our hearings into the focus areas, and each board member only has 2 to 3 of those this year instead of evaluating all of our applicants. Gives us a chance to dig in a little bit deeper on some specific areas and get to know our agencies a little bit better. Every agency this evening is, well, all of our agencies get 15 minutes, and we will open it up to questions from the board and staff. And then if we have time at the end, give you an opportunity to add anything that you'd like that maybe we have missed, that we didn't ask about. So Eliberto will be our timekeeper. If you all want to, I realize I have neglected to do this for some of the others, but if you all want to quickly introduce yourselves, since members of the board may not know who you are, that would be appreciated.
Sure. Go ahead, Soren. You want to kick it off?
Oh, sure. I'm Soren Thomas. I use they, them pronouns, they, them pronouns, and I'm the executive director of Queer Asterisk.
Hi, I'm Chris Aguilar Garcia. I'm the director of operations. I use they, them pronouns.
Great. Thank you both for being here this evening. If you do see folks going on and off camera, we do have several, we've had several hearings already. We've got some after you. I know that some people are in the, like, kind of doing dinner, but still here. So just so you know, we will aim to not show you our food if we are eating. So with that said, Eliberto, are we ready to start the timer if you haven't already? Okay, and then Deanna or Robert, do either of you have a question to kick us off? All right, Deanna.
So I was looking at the makeup of your board, and I know I mean, I don't know if you're a relatively young organization still, I guess I would say that, but your board is small. That may be intentional. I'm just wondering if you have plans to expand the board, if you're happy with the size of the board, and if you put any thought into that.
I will take that question. And yes, it is small. And we are very much actively engaged right now in board recruitment. We, historically, the profile of our board up to now was more specifically focused in just like kind of the mental health arena. And I think as we were growing, that's where we were really looking for leadership from the board. And we're now at this stage, and to where we've grown, where we're really looking now for some more diversity on our board, just in terms of that expertise and some more help with, what we need at this size as a nonprofit. So we're looking for some both, like financial, some marketing, and as well, also recognizing we want a more diverse in terms of like the lived experiences as well. So yeah, that is a very active push for us right now, is to expand that.
Okay, thank you.
Yeah.
So, one thing that often comes up is, what differentiates Queer Asterisk and the services you're providing from, we've got quite a few mental health nonprofits in the area. And obviously I think there's a growing need for it. And so where do you see your organization and this program fitting in with, the other organizations that do maybe similar work in the community?
Sure. I can start that question, Maddie, if you want to add anything else. So I'll say something that makes us unique as a mental health organization is that we specifically serve queer and trans community, and all of our counselors identify as queer and trans themselves. And typically clients come to us saying that they have tried to work with other counselors at other mental health centers in the past, and their identity somehow got in the way. So typically we hear two stories. One is either that the counselor just wasn't informed enough and didn't know how to guide a person who identifies as queer or trans. And then the other story that we hear is that their queer and trans identities just kept getting in the way for the therapist. They couldn't quite get past that, I would say at that point, that distraction to really be able to support their anxiety, their depression, their relationship issues. So the example I give is that, some of our folks are polyamorous, they have multiple partners, and they might have relationship conflicts, but the therapist might keep coming back to, well, could it be because you're navigating so many partners? No, that's part of my identity. There's a whole culture around this. So that's, I think, one way that sets us apart.
Other questions? Eliberto, Robert, either of you have questions?
So, thank you. That was one of the questions I had, Caitlin, about how they distinguish the services. So, Maddie and Soren, when the board looks at these applications, they have their own set of questions that they have to evaluate and review, and staff has their own. And I look at, primarily, I look at your agency section, I look at your strategic goals, et cetera, but I also look at your financials. And in particular, one of the questions that I look at is, compared to your project budget, what is the request that you're asking for? And when I did the math, and my math may be wrong, but I there's a lot of you got to do. your request of Longmont is about 28% of your project budget for that you're asking. And I guess the question I have is like, what's the plan to ensure that typically, we don't have tons we have that level of funding that we can provide. And I'm just wondering, like, how are you continuing to diversify and strengthen your fundraising efforts to rely less on government funding? Because unfortunately, government funding, as much as we can do, it's never going to be enough. And there's a lot of people asking for it. So just that question of how diversifying and increasing that financial stability.
Sure. Yeah, I think the same thing, kind of speaking similar to like our board development, that definitely, as a younger nonprofit, that the fundraising aspect is kind of a very important part that we're really working on developing and how to diversify where we are getting our funding. I think a couple of things that we do have in the works is newly, as of this year, we're approved to be part of the Colorado Combined campaign. And so that's one new opportunity to kind of get in front of some donors that we haven't been historically. And then as well, in a similar vein, we're also right now working on, we've just met our preliminary approval to be part of the Community Shares Consortium, which is also like a workplace giving plan. So that's another way to develop it. And then in terms of the specific request and that amount, that in among the three agencies, like how we've broken it up is specific to like the numbers that we would serve within each area, so that too the percentage is reflective of our presence in Longmont, and knowing that we do have a high concentration right now of folks who are in Longmont specifically, and that while we are statewide, I think we are and kind of Denver, serving the whole Denver metro area. We were founded in Boulder, and definitely feel like our work is very much centered kind of around the Longmont, Boulder, like that area. So that too, it might be a little bit outsized, but kind of representative of the specific population that we would serve.
And I'm not sure if this is helpful too, because I haven't been a part of any other organizations. This is my first one, being the director anyway. So I would imagine that at some point, an organization's real young, get some grants, and that launches them and they get going. We also rely heavily on fees for service. And for the first couple of years, we didn't actually seek any grants at all. We were able to accomplish what we needed to accomplish, or hoping to accomplish, with fees for services almost exclusively. And then I think that our desire for grants in this moment, and looking for any other kind of contributed income, is that the spike in need has been so great since the pandemic. So at the beginning of the pandemic, we had no wait list for a number of years since our founding. We had a wait list that shot up to 200 people, and then we had to close the wait list because it was unethical to have more than 200 people wait on a wait list. And then we processed those. So we had to grow our counseling staff, our admin staff. We had to bring in an HR company, a new billing team, a new EHR platform. So we just grew rapidly in size to be able to support that, but without really being able to rely on much more money from fees for services, because we're still trying to keep our costs as low as possible. And in fact, our sliding scale, folks aren't able to pay as much right now. So I think that's what we're seeing. I don't know our organization uniquely, and when we were founded, it's not a lot of grants. Then, oh shit, we could use some help. And then what Chris is saying is, some looking for diversifying our contributed income.
Thank you.
What do you think you mentioned a wait list of 200 folks and a whole lot of changes in, probably the last 18 months to 2 years. What do you think your biggest challenge for 2023 will be?
Definitely, I think kind of that continued the infrastructure. I think we've just hit on those two. I think both fundraising and I think more specifically in the day-to-day, what we're experiencing is the human resources. And as Soren shared, we are working with a group called Obsidian HR that is both providing both payroll assistance and HR expertise. But just as the staff has grown, just recognizing, the number of issues that come up, the unforeseen kind of circumstances, and particularly, I think, in mental health as well, that, the folks who are providing services are also living in this really difficult time and these really strained financial times. So we're balancing that workload for our employees and, kind of, another big part of our model has been, somewhat of a mentor program of working with folks early in their education and bringing them on, and recognizing now that also brings kind of a new wave of HR and personnel considerations for us of the support we have to provide for folks who haven't really worked in this arena professionally, or in some cases really in any other environment professionally. And doing this at the same time that there's, a national dialogue about, like fairness in workplaces and trying to balance our own desire to really be a kind and fair employer, but also having, target needs that we need to meet in terms of how many clients and how many hours folks are working. So the HR, I think, is definitely a growth edge for us right now. And definitely, I think we're looking at how to really address that. Day to day has been the case in most of this year, and really trying to, from what we have learned so far, really start implementing some changes that both support the sustainability of the organization and continue to allow us to be a very fair-minded employer.
I'm just going to add very briefly that there's a lot of staff turnover in the mental health field. I think we've noticed even more lately with inflation and working environments, and people are just, searching for something that's going to work better. And we've been working really hard to meet the standards that the Colorado surveys have set. Nonprofits at our size. And anyway, but I think the other thing I want to add is there's new conversations coming up, whereas mental health organizations that I was familiar with when I was a student coming into this field, there were models where organizations were relying on intern support, which is essentially free labor. And that is just not the culture anymore, and where we want to be, so we're trying to introduce conversations about paid internships, and that increases costs and shifts the whole dynamic. And so just constantly striving to do better as employers, while also constantly losing people and hiring new people and training people. And it's just a tough moment, I think, to be an employer, is my take on this.
Alberto, I assume you're about to tell us that we've hit our timer.
Well, we got about a minute left.
Okay. With that said, would you all, if there's anything that we have not touched on that you all would like to say, this would be your time to get your plug in.
Well, yeah, one other piece I would add, and I think this goes back to the first question of what makes us unique, is the community programming that we offer, that we provide that at no cost. And I think it's just several different groups, whether it's yoga, meditation, group conversation, So, it's always been designed that to kind of add something either for folks who aren't in therapy or as kind of an additional piece for folks who are, offers kind of a sense of community and belonging, and just recognizing, I think that's always been an important component to providing mental health services, but feeling even more so in this moment of having places where people can gather, and particularly for our community right now that, in the national dialogue, just kind of a lot of there seems to be from a lot of progress that has been social progress that has been made for our community of just fear of losing some of those gains, and definitely a lot more outward targeting of the community. So just even feeling more the importance of offering not only one-on-one counseling services, but also that community program, so folks have other places to gather and build connection.
Thank you. So we've hit our 15-minute mark.
Great.
Thanks, everybody.
Thank you for joining us tonight.
Thank you both.
Yeah, absolutely. Thank you.
Thank you.
All right.
Have a good
Good
night.
night.
All right, so Recovery Cafe's on the line. We are knocking these out.
Right.
Hello.
Hi,
Hey,
Lisa.
Lisa.
Hello. Are we expecting anyone else for Recovery Cafe? Or is
Nope,
it
just me.
tonight? Okay, fantastic. I'm Caitlin Abbott. I'm the chair this year for the Housing and Human Services Advisory Board for the City of Longmont. Tonight, you will see that we've got two other board members, Deanna and Robert, as well as Eliberto from staff. This is a smaller group than you have likely seen in the past for these hearings. That is intentional. We've divided up the focus areas for the city among our board members to allow us a little bit more time to dig into some of the agencies and applications and devote more time to those. So every agency gets 15 minutes. We will start with questions from the board and staff. And then if we have time left over, we'll give you an opportunity at the end to share anything that we may not have touched on. So if you would like to do a quick introduction of yourself and your role with Recovery Cafe, we can do that and then we'll start the timer.
Okay, I'm the executive director and I've been with Recovery Cafe Longmont since it was started in 2018. And I made the transition from being executive director at Hope because I heard somebody say that recovery is the key to ending homelessness. So I thought, I'm all in. So here we are.
All right.
It's a big statement. I don't know that that's the only key, but it's certainly one pathway to ending homelessness.
Awesome. Thank you. Eliberto, if you want to start our timer. All right. And then we will start with questions. Deanna or Robert or Eliberto, anyone have questions? Okay, Deanna.
So I thought I would just ask a question about how Recovery Cafe has handled coming sort of, I don't know if I can say coming out of the pandemic, but it feels like we're sort of coming out of the pandemic. And how, because I know in-person services were really stretched, right? Because it was difficult to do in-person meetings and things like that during the pandemic. I'm wondering how you guys have weathered the storm here in terms of coming through.
We are back to pre-pandemic numbers. We have served, as of the end of September, we've had 214 unique individuals visit the cafe. A proportion of them choose to become members. That kind of goes up and down, but it's roughly a third. A third to a half of guests who visit the cafe choose to become members. Not all of them are successful and continue as members, but usually there's a lot of enthusiasm at the beginning. And then as the accountability piece comes into play, we do definitely have some attrition. We reopened as quickly as possible. We closed twice in 2020 and reopened for good in February of 2021. Wearing masks, socially distanced, we changed some of our services, but we knew, we saw, we heard, we listened. The whole model, our model is being together in community, and it just doesn't work virtually. And we also know that a lot of folks who struggle with substance use relapsed. Isolation is the silent killer of substance use, and folks who are struggling with their mental health really need the kind of supportive community that family and friends and what we offer. So we were eager to open as quickly as possible, and of course wore masks. And then we said you don't have to wear a mask. And then when we had the surge, we had to go back to wearing masks, and everybody was respectful. We did have a few folks who said, I'm not coming back until I don't have to wear a mask anymore. And we had one volunteer who said, I'm not volunteering anymore because I don't want to wear a mask. So for the most part, people were very respectful and just eager to be back, even if it meant wearing a mask. Now, we do have a lunch and beverage service, so individuals are permitted to take off their masks during service. So we were constantly going like this, put your mask back on. And but again, everybody was respectful. And when Boulder County lifted the last alert, we made masks optional. And we still have kept in place some of the seating arrangements and serving food as opposed to having a buffet that we implemented during the height of the pandemic that we'll probably just keep because people are used to it and it's a little safer that way. But I'm pleased to say that we are back to pre-pandemic levels, and I'm not a pessimist, but I have a feeling we're probably going to have to go back to wearing masks before again. So we have a closet full of masks and hand sanitizer, and I'm sure they'll be put to use, unfortunately, but better than closing.
Thank you.
Aliberto.
Hey, Lisa. So thank you for sending up that updated program budget. I did get it to the board. No worries. I do have a question though about your strategic goals. I read through them, and what was interesting that I didn't see, but I know is an active conversation you have, or maybe I missed it. So if I missed it, I apologize. But I know that you've been having this conversation, and your board has, and just wanted to just check in with you. I know you're looking for, I mean, you as you are growing, you are outgrowing where you are now. And I just wanted to check in on that progress or those thoughts about a different location.
Yeah, so the goals that I have in the application are probably more programmatic goals. But yes, we knew when we started the cafe that we were only going to be in the church temporarily. When we were invited to join the cafe and our application was accepted, we looked around and saw that it was expensive, and we didn't have any money in the bank to be able to pay rent and do renovations. So I approached church leadership and said, can we be here for 2 to 3 years, build our base, establish our model, and then move out into the community? And they said yes. And then we got COVID hit. We formed in 2018. We opened for services in May of 2019. So less than a year later, we had to close for COVID. So the whole search for a new facility got put on hold. And the church said, we can stay as long as we need to. I said last year, it's been 3 years, and I think we should start paying rent. So we are now paying rent. We're no longer rent-free. And we are actively seeking a new facility. We love being there. It's a great location. We've improved the space. It's beautiful. But a church can be a barrier for some folks, and it's not ideal. It's in the lower level, and there is some accessibility that's a challenge for some folks. So that is a strategic goal. I wouldn't say it's a programmatic goal, but yes, we are actively looking right now to move. And we have tucked away, if you saw in their funds, so we can, when the right location comes, we have some assets that we can put to that and leverage what we've tucked away, and hopefully access some other funding opportunities to help us move.
Great. Other questions? Lisa, I think the last time, last year when you applied, I think one of the things we talked about was you were looking at expanding program offerings around Spanish speaking, the Spanish speaking population in Longmont. And I think I saw that you currently have 2 bilingual folks on staff that are helping facilitate that. I wonder if you could talk a little bit more about how those efforts have been going.
Yeah, they're bilingual and bicultural. We had, if you'll keep this to yourselves, our first bilingual bicultural peer support specialist had to take some personal time off, and you can fill in the blanks.
Before you say anything else, got to remind you, this is technically a
being
public
recorded. Yes,
public hearing that's being recorded.
Being recorded. The outreach and momentum that we had built kind of slowed, and it took a while to hire again. Hiring is very challenging, and hiring, I found a bilingual and bicultural peer support specialist. So that's somebody with lived experience and who hopefully is in long-term recovery, is particularly challenging. But we have one full-time position that is actually funded right now through Mental Health Partners for the bilingual bicultural peer support specialist. And they are both working more than 20 hours a week. So I kind of have a 1.5 FTE, even though it's technically 1 FTE. And we are rebuilding that program. I mean, it never went away, but the progress and the momentum that we had made, unfortunately, stopped. So I learned that it's not ideal to rely on one person to carry the load of a whole program. And the goal now is I'm applying for more grants to hire even a 3rd person. So we can, that's a huge goal of ours, to get that program rebuilt and strong again, and we're on our way.
Great, thank you, Lisa. Other questions from staff or board members?
So I happen to know, I work with Lisa on multiple things, multiple committees. And so, so I happen to be more involved than the board is. Can you talk a little bit about, for the board to know, a little bit about your outreach efforts and some of the outcomes that's coming out of that? Because I know you're doing, you're working with Elder, you're working with, the what's it called? I'm blanking on the harm reduction program.
The works program.
The works program. Can you share a little bit with the board about that work and maybe some of the outcomes that you're hoping out of that outreach?
Sure, yes. The harm reduction work that we're doing with Boulder County Public Health is also partially grant funded. Half a position is funded for that. And our staff member, Becky Melansky, who was just honored, I don't know if you read the Longmont Leader, but she's receiving an award on Wednesday for having an impact in community health in Boulder County and helping connect harm reduction and recovery. And she goes out weekly with the Boulder County Works program. And that, if you're not aware, that's basically, it's needle exchange and making sure that people who are using drugs are safe. And you'd never know when somebody who is using drugs is going to be ready for recovery. And we believe that people who use drugs or struggle with substances. It's addiction is a disease. It's not a moral choice. I believe that personally. And when somebody is ready to treat their disease, whether it's with medication or other avenues, recovery can happen. And Becky is in recovery herself, and she is a role model for people who are ready for recovery or might be considering recovery. And going out and doing street outreach and meeting people where they're at is a non-threatening way to communicate that there are opportunities if and when you're ready to seek and receive recovery. So that's through the Works program. She and Madeline go out and see between 20 and 30 people sometimes in a 2-hour period. And folks also come to the hub to receive Works program supplies. And Becky also helps in the Works program office at the hub. She also goes out with Hope and Andy, their outreach volunteer person, and interacts with people who are experiencing homelessness and gives them information about the Recovery Cafe, not necessarily about recovery, but about just come to the cafe, check us out. Same thing with the Works program. It's come check us out, come have a conversation. It's just come have a meal, see what it feels like to be in a community with folks who understand and are compassionate. And same with Elder. And even if we don't go out, we'll call them. We have somebody and they refer folks to us. I know that when street outreach is done and somebody is seeking, sometimes it's just a warm meal. I mean, you can come to the cafe as a guest and have lunch and check us out. So there's a lot of collaboration that way with outreach. And it's hidden in the application, but we started doing a satellite recovery circle at the halfway house, also known as LCTC, and that has really taken off. And I consider that a form of outreach. And it's not just for folks who aren't ready to come to the cafe, but I've learned since we started doing that, and we were trying to do satellite circles for a while, and this one happened because one of our peer support specialists made the connection. He actually used to stay at the halfway house. And sometimes they're not allowed to leave the halfway house. If you have been late for curfew or had a hot UA, then you are not permitted to leave the halfway house unless it's for work. So some folks are not allowed to come to the cafe during cafe hours. So we're going to them. That's another form of outreach. And that has really taken off, and it's only been a month. They had a circle Saturdays after the cafe closes, and there were 8 folks in the circle. And every day that we're open, we see new folks come in from LCTC to check us out.
So our time, you got about 20 seconds left, Caitlin.
Sorry.
Okay.
I talked too much.
No, this is great. Lisa, if there's anything else you'd like to add, we have just a very short period of time, but we'd love to see if there's anything else you have to add.
I wanted to get in that LCTC satellite circle because I'm just so impressed that it came from one of our staff. He made it happen, and it's really taken off. So I'm just thrilled about that. It's not something that I made happen. It came from organically from staff.
Awesome.
No, I just think the only thing I'd like to add is to thank you. I know your volunteers, and Eliberto, you shouldn't be working at 8 o'clock at night. So I just want to thank you all for the hard work that you do, and to take the time to learn more about all of us in the community that you support. So thank you.
Thank you so much, Lisa. We appreciate your time tonight.
Okay. Thank you.
Bye.
Bye.
All right, we got a couple of minutes before our next person. We are in the home stretch.
Which is good because I'm cooked.
I know, we're getting there.
I've been up since 5 this morning, so
I'm so sorry.
No, it's good. I'm glad to get it knocked out. But
and the good thing is, I'm hoping Rise Against Suicide, they were disqualified last year because they didn't come.
Oh, right.
So I'm excited to see them here. They're the next group, but yeah, they were just reminded they were disqualified because they didn't show up to the hearing.
I'd forgotten that. I thought
Yeah.
about how sad that was after you put all that work into that application.
I know.
Ugh.
So yeah, but we got a couple minutes. I'm gonna take another bite.
I'm still here. I'm just eating, so.
I was just gonna, I worked for many years with Boulder Polydrug Abuse Clinic. And I want to say how sympathetic I am with their problem. Dealing with drug addictions is extremely frustrating and disappointing in some ways, because it doesn't seem to matter what venue or what type of therapy or remedy you're proposing. It comes down to they get bored doing what they're doing and they decide they don't want to do it anymore. And it doesn't matter what the venue, what the mode is of recovery. They just change. They just get tired of it, and they just decide. And then if anything works, any kind of therapy works, and it's a very frustrating job. And I really am sympathetic with how difficult it is to help.
It is it is very difficult. I think that's true of a lot of target population served by people that the agencies that we work with. Like, I do a lot of domestic violence work. It's the same thing. It's very frustrating because it's very difficult to get domestic violence victims and survivors to a spot where they're ready to actually leave. And so it can be very frustrating work there too. It's the same sort of like, it's hard to help people that are struggling with accepting help. So it's hard for sure.
Yeah.
Well, good news. Rise Against Suicide is here tonight, so they will not be disqualified for funding. So yeah, we can bring them in, Brenda.
Hi, Jenna. Hi, I think it's Kaylee.
Yeah,
that's correct.
Is Trudy with you all? She's in the waiting room. I just want to make sure that she is one of yours. You're on mute, Jenna.
Trudy's not with us.
Okay, then she can wait.
Okay.
I just want to make sure she's in the waiting room.
Okay.
All right. Are we waiting on anyone else? Are you all expecting anyone else?
No, just us two.
Okay. Okay, great. Hi, my name is Caitlin Abbott. I am the chair for the Housing and Human Services Advisory Board for the City of Longmont. With me tonight are Deanna and Robert, who are both board members, as well as Eliberto, who is on staff here for the city. And if you have been to these hearings before, you may notice that we have a much smaller cohort. We have actually divided up all of the hearings among our board. We have enough folks for it to continue to be a public meeting, but we wanted to give everyone an opportunity to dig in a bit deeper on a subset of agencies. How this will work is every agency gets 15 minutes. Typically, we will start with questions from the board and staff. And then if there's any time at the end, we will give you an opportunity to add anything that we may not have touched on that you think we should know about as part of your application. To start off, Eliberto is going to keep time for us, but it'd be great if you could give us a quick introduction of who you are and your role with the organization, and then we'll start the time.
Sure, go ahead, Kaylee. My name is Kaylee Radwa, and I am the development coordinator at Rise Against Suicide, and I have been here for about a year.
And I am Jenna Clinchard, and I'm the executive director for Rise Against Suicide, and I've been with the organization since 2019.
Great. Well, thank you. Welcome to you both. Eliberto, I think we're ready to start the time. And are there any questions that we want to start with? Deanna.
Good evening. My first question, we're doing health and well-being interviews tonight. And so we've heard from a lot of organizations providing mental health services. I guess I'm wondering if you could just give us a little information about what you think distinguishes your organization and makes you unique compared to maybe some of the other organizations we might have also heard from this evening.
So I would say what makes us unique, and thank you for the question. We serve youth struggling with suicidal ideation only. So it's not the full spectrum of mental health. It really is when that kiddo is almost to crisis in ideation. They're not quite to a plan. And I think another thing that differs for us is that the youth that are referred to us can start seeing a therapist within 24 to 72 hours. And that's not an intake. They've already had their intake through the schools. So they will start seeing that therapist weekly or twice weekly if needed. And I would say that's probably really kind of what sets us apart from the other mental health groups in our area.
Great. Other questions? Yes, Robert.
Rise Against Suicide, the assumption is that suicide is bad. I had a friend who had a disease that was not correctable, was not curable, and he chose suicide as a way of getting around all the pain. He was actually smothering to death. And so suicide in itself is not bad. In some cases, it's an acceptable choice or acceptable possibility. And I wonder, do you just go at it that suicide is wrong, as opposed to suicide might be the solution to certain kinds of problems, like medical problems or other things? And I was just wondering is it just like, do you treat everybody that has suicidal thoughts? What if they're logical suicidal thoughts, like my friend's idea of euthanasia and his appeal to me to get him some fentanyl so he could end it all? I didn't, by the way, but nevertheless, I can see that suicide in itself might be the correct answer. Incidentally, he was an assisted death, which is suicide, basically. So that's what I'm asking you, is how do you go about deciding?
Yeah, thank you for your question. So we don't decide. The decision isn't up to Rise Against Suicide. We don't make that decision for kiddos. Those kiddos are referred to us from a qualified referral source. And that child has spoken with that qualified referral source and shared with them that they do want help. And they want help for the suicidal thoughts that they're having. Does that make sense?
Well, yes and no. With the case of my friend, he had suicidal thoughts and also thoughts of continuing on, and decided that in the long run, suicide was a better answer than going out the way, suffocating to death, basically.
Mm-hmm.
So that, yes, he was referred, but, in this country, in Boulder anyway, at the time, you couldn't just go get assisted euthanasia. You had to have a doctor agree. You had to do all this kind of stuff in order to get there. Mm-hmm. And I just found it, he was forced into elongated suffering, let's call it, extended suffering, while all of this bureaucratic nonsense was solved. He wanted to go to Oregon because it was easier, but even there you had to live there for 6 months. That's not true anymore, but
yeah,
I'm just saying that somehow there's this notion that suicide is bad. I'm not a very religious person, obviously, so I don't think there's a soul, involved in all this. But nevertheless, I don't see it as a necessarily bad thing to agree to it.
Okay.
So, Deanna, go ahead if you have a question.
Well, I was just going to follow up on that and say that I'm guessing that the vast majority of people that you're serving aren't suffering from long-term debilitating illnesses where they're seeking assisted suicide. They're teenagers, right? Who are,
Yeah.
right. So we're probably talking about maybe a couple different things, like end of life kind of stage decision-making process for people who have chronic illnesses versus teenagers who are struggling with severe depression and yes.
And ideation. Yes.
And
very
ideation,
well put.
yeah.
Mhm.
So,
Yeah, under.
right. So I thought maybe actually I could direct a question to how you get the students that come to you. You're getting them through school referrals and I'm guessing maybe counselors at school.
Yeah, so counselors at school and the core program up in Longmont, they now refer to us. And the city, the youth center in Longmont refers to us. So what we've done is COVID closed the schools, right? 80% of our youth came from the schools and the school districts. So when COVID closed the schools, we branched out and started creating new partnerships. So still a majority of our referrals come from the schools. However, we also now have community partnerships. We partner with other nonprofits within the community and they refer suicidal youth to us as well.
Okay, thank you.
So I have a different question, but I want to go back because that's news to me, the core piece, right? So for those, I mean, I think the board knows it, but core is that co-responder. So it's a police officer and a mental health person and the paramedic. I think it's those three.
Yeah.
So that was news to me. That's interesting to hear that, because I didn't think that. I mean, I'm assuming that they do work with youth, but I'm assuming that that's not their primary population to work with. So that was news. But the question I have is, I read through your strategic goals, and I think they're good programmatic goals, but I'd love to learn a little bit more around some more of your strategic agency goals. For example, I wrote down some notes about, would love to learn more about what your sustainability plans as now that, because schools are back open and now you have more community partners. So that in my mind means your demand for your services is going to increase. So what are some of the thoughts that the board has put into as you see increasing demand? How do you ensure sustainability?
So our referrals did increase 134% last year, and our sessions increased 156%. And we're projecting growth again this year. How we are going to sustain that is by retaining our therapists, first and foremost, and retaining our relationships in the community so people know how to refer to us. In terms of funding, Kaylee has come on. I'll let her talk a little bit about that, but Kaylee's come on and do you want to talk about funding, Kaylee, and how we're going to sustain and still serve all these youth that are being referred to us?
Yeah, absolutely. So like Jenna mentioned, I started about a year ago, and with that, our funding has increased quite a bit. And now that I have a year under my belt, we will be increasing that even more. We have two large fundraising events, one that goes from November until the end of the calendar year, and that is our Holiday Star program. And we are hoping to increase the funding from that by about 10% from last year. And then our second major fundraiser is our Merge 5K, and that's our largest fundraiser of the year. And we, invite the entire community out to this free event. And we also are going to be increasing that this year. Another big thing is our grants. I started grant writing in May and have already applied to new grants and have increased our asks for each grant that I've applied to. And we'll also be increasing that funding by 5%.
So I think one of the trends that we have seen, particularly with mental health providers, is that there's a variety of challenges. Increase in need for services across the board, increase in
suicidal ideation, increase in actual completed suicides, other mental health issues, not to mention staffing and things sort of on that administrative side. I'm curious for both of you, what you think the biggest challenge is for your organization for, the coming year. On the programming side, I am challenged and we continue to be challenged to find bilingual therapists that are available to see our youth. They are mostly full. Currently, we have 3. When I started, we had 2, but I mean, we continue to reach out. However, a solution to not having bilingual therapists, because what we learned from one of our partners at Longmont Youth Center is that the parents need the Spanish speaking interpreter. The kiddos are bilingual. So we have brought on a contractor to be an interpreter and a translator for us. So they now are working with our therapists and with our QRSs and with their parents. So our children don't have to translate between them. So it sounds like that's in part because it's not part of the clinical setting of providing the therapy, but it's really about, the communicating with the parents as part of that, so that the kids don't have to be both patient and translator. That's right. Yeah, we won't allow that to happen. We know that that's not right. So yeah, we just want to make sure that that's covered. And so that's, I think for me, that's what I look at as the biggest challenge this year. Kaylee?
For me, I, agree with Jenna. Finding culturally responsive therapists is extremely important to us and is a challenge, just based on, people of color. Therapists aren't, I think there's only 6% of therapists in the nation who are people of color. So that's always a challenge. In regards to fundraising, most of our donations are from individuals, and it's seeing how responsive the community is year after year. There's so many things at play. There's recessions, there's inflation, and other societal things that happen that can impact fundraising. So for me, just making sure that we are staying in front of the community and making sure the community is just as responsive to the needs of the youth in the community as we are.
Other questions? Elevator, where are we on time? Just doing a quick time check.
So we are at about 1.5 minutes left.
Okay.
So can you talk to me about how your, and I usually take notes on this. I'm surprised that I didn't have a note on this about your board diversity, Jenna. And because I know you've been working on it, so I'd love to hear the progress on that.
Yeah. So thank you for asking, Eliberto, because I have been working on this since 2019. And our board definitely is more diverse than it was when I first met you. And I'm super grateful for that. And I'm proud. Like, we have more representation on our board from the communities we serve. Like, our goal was, we want our board to reflect the youth that we serve in our communities. And I think it does. Did you see our numbers, Eliberto? And we have more people from Longmont, which was important to me as well. We needed more Longmont voices. And so in terms of, I think we've covered it pretty well. And we keep moving forward. And we're going to, and that's important. Oh, and our board, we did DEI training in June, and that is going to continue every year. We're going to continue to be trained. We're going to continue to educate. We're going to continue to learn, because it's really, really important to our board. It is on our strategic plan. Did that answer your question, Ellie?
Yeah, thank you. I mean,
I got a little excited.
Yeah, no, that's great. That's great. Because yeah, I will. I just don't have a note. I usually have notes on these things.
I
And
know.
didn't.
I'm gonna send it to you. I'll resend you our demographic for
All right.
the board because it is exciting to see.
Thank you.
Can I say one thing?
Sure. Yeah. Our timer has gone, but we'll let you finish out.
Okay.
Yes. We'd
So
love to hear one last.
okay, so last year in Longmont, we served 183 youth and we funded 1,495 sessions. And that's more than the other school district that we serve. And in sessions alone, that's $134,550 in St. Vrain alone. And we're super proud of that. And so I wanted to share with you that, you know, yes, the kids in St. Vrain School District are struggling, but we want you to know that we're here and we're helping them every day.
Thank you.
Yeah, thank you. And thanks for your continued support, everyone.
Thank you.
Are we out of time? Do we have to go now?
Yeah.
Okay.
We are out of
Thank
time.
you. Thanks, everybody.
And we got folks in the waiting room. So.
All right. Okay.
Thank you
Bye.
so much to both of you for your time. Have a great night.
So before you let them in, there is one person we don't know. So we got, I think they're with St. Benedict's, but they're not, they weren't on the list. So we're gonna the only way we can talk to them is letting them in, and then we will find out. But Brenda she was chatting with me saying that this person's not on the list. Her name is Trudy, so we will find out. Go ahead and let them in, Brenda.
All right, here we go.
Hey, Shelly, can you hear us? Hey, is Trudy with you? Trudy, are you part of St. Benedict's? She's not.
No, I don't know Trudy.
Hi, Trudy. Are you with an organization? Okay.
She jumped off. Okay, we just didn't know who she was. She wasn't on the list, so.
I actually removed her. I don't know if somebody bombed the Zoom or whatever, but we don't want to risk that. So I actually just removed her. And if she's supposed to be here, she'll come back on.
Okay.
All right.
All right. Just wanted to make sure that this person was meant to be here. She's not somebody who reached out about public invited to be heard, was she?
No, I have not heard from anybody. And I searched my emails, I searched the contact list, I
Okay.
searched in different formats, and I was not able to find any contact for this person.
Okay, that's fine. Just wanted to make sure. All right. Sorry about that, Shelly.
Oh, no, that's fine.
Okay. So
All right.
turn over to Caitlin.
Hi, Shelly. Great to see you again. I am Caitlin Abbott. I am the chair for the Housing and Human Services Advisory Board for the city of Longmont. You'll see tonight we've got Deanna and Robert, who are both board members, and Aliberto, who's our staff person here tonight. We've gone through this before, but I'll give you a quick overview. You've got a smaller group of board members tonight. Intentionally, we have split up the hearings among the board rather than having the board attend all the hearings to allow us to dig a little deeper into some focus areas for the city and get to know some of our agencies a little bit better. Every agency gets 15 minutes, and we will start that. Eliberto will be our timekeeper, and we will start that, and we'll kick off with questions from the board and staff. And then if we have time at the end, we'll give you some time to add anything that we might have missed or that you'd like to make sure that we know or hear about. Before we start the timer, so since some of us know you and some of us don't, it would be great if you could introduce yourself and the role with the organization.
Sure. Hi, everybody. I'm Shelley Deerking. I'm the executive director at St. Benedict Health. We're trying to shorten our name and not have the and healing ministry and everything. I came on in June of 2020, so in the middle of the pandemic. And so I've been here just over 2 years, and Colorado native, and I've always worked in healthcare and super excited to be on board with St. Benedict. I'm the only full-time employee, so.
Awesome.
Great. Thank you so much. Eliberto, we are ready to start the timer. And if Deanna or Robert, all right, Deanna, please.
Hi, Shelley. I actually did your site visit, so I'm pretty familiar with you and your organization and the work that you do. I just wanted to highlight your board demographics because we talk a lot about diversity of boards and how important it is to us. And sometimes I feel like we're just paying lip service to it and telling the organizations diversify, diversify, diversify. And then next year they come back and the board looks exactly the same. So I just wanted to highlight that if I'm reading your graphs correctly, I think you've done an excellent job diversifying your board. And I thought maybe you could talk about how you did that.
Yeah. We had always, I think most of you may know from a tax perspective, we're under the umbrella of the Episcopal Church. So we try to be an independent nonprofit, but we really still have some ties there. And so historically, even though we've been around coming up on 20 years, our board was always all white, all Episcopal Church members, very often priests, and very often older folks. So that's the kind of board that I came on to. And granted, we had to make changes a lot really quickly just to operate during the pandemic. I don't have to go into a lot of those challenges, and a lot of those board members were really reluctant to add a mobile clinic, do COVID vaccines, do all the things that were needed in a pandemic. They just have never pivoted. They're very old school, stick to the plan, don't spend too much money, don't take on risk. And so the first year we applied to City of Longmont, we had never had health and human services funding before last year. That was one of the things you guys called out, which actually I told Alberto and you, Deanna, was really helpful to me because, they think they embrace diversity, but they had no idea what that looked like. So now most of those folks that were on our board have left. Some of them left because their 2-year terms had just by chance, gone by the way, had run their course. But it's been really great. I have had lots of folks try to put people on the board who did not represent diversity or where we're trying to go as an organization. And I just kept saying, no, no, no. And now it's been wonderful. So I have 2 board members who are people who are Black. I have a very strong Hispanic Mexican immigrant person who came to this country undocumented and has done a lot to help, and also has a son with autism. So she's really helped us in so many ways. And so I have my first person of Asian descent on the board. We have a person that's LGBTQ. So we're a whole different organization than who we used to be. And it has been very helpful in not only where we want to go and what we want to do, but being able to deliver our services respectfully, I think. So, and then more equitable.
I'd like to jump in. I saw this in the application, and I think it came out a little bit in your response there, is pivoting during the pandemic is something that some organizations did a lot of and some didn't do any. You mentioned that. I'd love to hear a little bit about what you think sort of some of the biggest accomplishments were for the pivots that you were able to make.
Yeah, so we had not operated since the pandemic started when I came on board. So from March of 2020 to June of 2020, there were just no clinics because we always relied on public buildings, churches, community centers to be indoors, our partner organizations to host our clinics, and nobody was allowing anyone indoors. So I was like, and most of our volunteers are retired clinicians, so, and older and in a high risk group. So I was like, we got to operate immediately. Actually, I got some lead time in May before I officially started June 1st. So we did our first outdoor clinic in June, and I had a core group of first 5 volunteers who said, yes, I know there's a need. I'm going to come out and do it. So I really take my hats off to those volunteers. And back then we were going, oh, maybe the pandemic will be over soon. Nobody knew. So, but by August, the writing was on the wall, and we had some rough weather situations doing outdoor clinics. And gosh, we saw unbelievable things from the time of March to June, like the closing of public bathrooms and the number of skin infections and lice and scabies. I mean, the people we take care of, mostly a lot of whom are unhoused, were just suffering. So I think that also was a rally cry for our whole organization to say, we've got to operate. So I did get our board at that time to go for a mobile clinic, and we added that. We did a fundraiser in October of 2020 and raised enough for the down payment and purchased it in November and immediately put it into service. So that was huge. And then by January, I was saying, we got to do COVID vaccines. And all of my clinicians who'd come out during the pandemic really wanted to do COVID vaccines too. We'd always partnered with someone else, but at that time, it was so hard to get a COVID vaccine. I don't know if you guys remember those early days of 2021. So by May, we were a COVID vaccine direct provider with the state, Colorado Department of Public Health. So that was huge. So we would go out with our mobile clinic, set up mostly outdoors, and get vaccines with no appointment necessary. So I think that's been huge. And then Kaiser first reached out to me and said, we heard you guys have a mobile clinic. We've got about 200 patients in Boulder County who are homebound. Will you go and vaccinate them? And that was never anything I planned to do, but I just felt like so many things had lined up for us to get the mobile van and become a provider. I'm like, yes, we'll do that. So we became a homebound vaccine provider and then continued to partner with Boulder County Public Health to do that. So, I mean, those things have just continued to grow our outreach, grow the number of people we serve, the types of services we can offer. Thanks to our partnership with our diverse board, we were able to do vaccines for Colorado Center for the Blind. And we went down in Littleton, and we went up to Weld County, and we did a vaccine clinic with Habitat for Humanity up in Greeley. And so, I mean, there's just been, I always say good builds on good. So we had a lot of really great things happen. And going into 2023, I mean, I think we all know that mental health issues are a big deal right now for everybody. Folks are struggling. We saw that during the pandemic because a lot of behavioral health became telehealth, and that doesn't work for the folks we serve. So we are planning to expand to do what the Colorado Health Foundation wants to fund, which is non-clinical programs of recovery. So it would be like weekly kind of group sessions focused around mentorship and support and music and creative writing, and just kind of building a community, and then celebrating milestones like sobriety or adherence to your medication treatment plan and housing and jobs and all kinds of good things. And so we're excited about that too.
So that brings up a question for me, Shelley.
Yes, please.
And the concern.
Sure.
So, there are quite a bit of agencies doing what you just talked about.
Sure.
And so the question I have is if that's something that you are all interested in. So it's really two questions. One is, are you concerned with mission creep? Have you had that conversation? And then two, if not, if this is something that fits along with what your mission and vision is, then what are the thoughts around ensuring non-duplication of efforts and working with, because right before you we had a recovery cafe.
Yep.
So
yeah, I do think Recovery Cafe, we have actually met with them and considered modeling our program after them. So I'm going to tell you straight up, we do Sunday clinics in Boulder, and almost everybody we see on Sundays are unhoused. And we're talking like 100 and 150 people that come out every Sunday for the free meals, that are provided at the churches. So it doesn't, what we're planning to do in pilot, we're planning to pilot within the city of Boulder. So we don't want to have mission creep at all. And we're not trying to do a clinical program of treatment, but we are trying to add a service for the folks we see, similar to what Recovery Cafe does. And that's not like our primary mission. Our primary mission is still our free clinics, our gap care, our managing diabetes support and managing hypertension, and still doing our vaccines. That is the core of what we're doing. So, a good question.
And my recollection and from the application, a lot of what you're doing is folks who generally don't have a medical home in the first place. And so it is the goal really to help with that, like with mental health care for folks who would otherwise just not have it.
Yeah.
That's kind of what it sounds like.
Yeah, and I would say maybe about 60% of the people we see do have a medical home. Okay. And we're helping, like at the Hour Center, we'll do a lot of weekly blood pressure checks or weekly glucose checks. And then we make a flow sheet and we copy that and have them take it with them to their provider so they have a record to see. So we're trying to work in partnership with our providers, but for the people who don't have that medical home, we definitely are trying to be another layer of just support. And because we see the same people every Sunday, and I go to all the Sunday clinics, I have, we're going to start with a core group of maybe 10 or 12 and just see how it goes to see if we could support them.
Other questions? Diana or Robert? Or Alberto? What do you think is the biggest challenge facing your organization in the next year or so?
Me being the only full-time employee. I mean, I have been trying to hire another full-time employee since I came on board, and we just haven't had enough funding for the board feels comfortable to go for it. So I've hired like a part-time clinic lead, and we work our butts off, our volunteers and myself, and they were just like, yeah, it's too much work, I'm not gonna do this. So I've had trouble keeping people, I'm not gonna lie. I've hired 2 and lost 2 in that role. So we really need another full-time person where we can offer them a full benefits package and a nice salary and be able to keep somebody. I just, if I go down, the whole organization goes down, and we know from the succession planning, it's not a good place to be. So.
Alberto, I think we maybe are nearing time if we want to give Shelley.
Yeah, we were at 2 minutes.
Okay, so we've got about 2 minutes. If there's anything, any final pieces of information or anything that you would like us to know as we are considering the application and moving forward.
I think I just, first of all, I said this during our audit meetings, I want to thank you all for helping push us. We hired a bookkeeper, and now our financial statements are amazing. We have a CPA. Before we had a volunteer bookkeeper. We have a diverse board. So, we have gone through a period of a huge amount of growth in 2 years, and we know we've got to, stabilize and continue to do what we do very well. But I do think, even though a lot of things we felt pushed and it was very uncomfortable, especially for our board, it's been a really good partnership, and we're just grateful. Appreciate it.
Thank you so much for your time tonight, Shelley. We really appreciate it.
Thank you, Shelley.
Nice to see everybody. Yep, you too. Thank you. Have a good night.
Bye. You too.
All right, so we got our last person in the queue. Someone else joined. We had two people join that they dropped. I'm not sure if Brenda, if you took them off or if they just dropped off.
No, they jumped off. I think they thought they came in too early, but it was Tech Pals as well, but I can't remember the name. I'm sorry. I'm already like, I don't know who it was.
I know it's been a long night, folks. But this is our last group. We don't have any more after this. So we can let them in early and see if the other person shows up.
Hi, everyone.
Hi.
I've got a couple other people on our team that wanted to join. Can we invite them in?
They're not in the waiting room right now, but as soon as they get here, I think we could.
Okay, cool.
Someone came in the waiting room and then they stepped out. So
That might have been me 2 seconds ago, or I think Trudy was in and out as well.
oh, Trudy was with you. Okay.
Oh, no, I'm Leah. It was probably Trudy. Here, let me post my name here.
Okay.
That's all right. Apologies.
There was some confusion here at the end of the night. So if you wanna communicate with them that this time that they can come back in, then that would be great.
Yep, I'm doing that.
Okay, Mateo's good.
Yep, that's he. That's one of our people. He's on our board.
Okay.
Hi,
Yeah,
Mateo.
All right. Yeah, sorry. I think there was a little bit of confusion earlier in one of our earlier sessions here.
I think Trudy had joined maybe a couple of sessions ago, and then we were like, but then left and we didn't know who it was. And
Yeah. So she told me to come in and then like introduce them so you guys know who's coming. She was like, "Oh my God, they kicked me out. What's going on?" And I'm like, "We don't start here."
We just like to keep you guys on your toes.
I did a search every way I could and I did not see her name coming up. And so it's like, I don't want to have a spam or something. We got bombed. And so I kicked her out. I'm so sorry.
Okay, and then Bob is calling in. So he's from Reality Garage. He's a VR guy that we're working with.
Okay.
So he was gonna phone in.
I'm in the library right now. Do you mind if you could turn on the chat? Is that a thing that you guys can do? Just because I can't really talk right now. I'm sorry.
Oh, why don't you can also text me at any time and I could chime in for you too.
Okay, sounds
I think
good.
we can't turn it on for the city ones. I don't
Right.
believe the city supports the chat for our meetings.
Yeah, because these are public hearings. Like,
Oh.
I mean, yeah, they're technically these are going to be available to the public.
Yeah. I was gonna say, so I don't have that capability.
So if you can text
looks like
Leah.
Bob has joined us.
Oh, hey,
All right.
Bob.
Okay.
So, and then if Trudy joins again, I think Brenda can let her in from the waiting room.
I will let her in. I will let her in immediately. Okay.
Okay.
Uh,
So she wants the meeting personal ID. Give me 1 second here. 878. Hold on, just 1 second. 878.
Hi, all. I'm going to step away for 1 minute. I'll be right back.
Okay.
All right. So my name is Caitlin Abbott. I am the chair of the Housing and Human Services Advisory Board for the City of Longmont this year. With us tonight, Deanna and Robert are both members of the board as well. And then Eliberto is a member of staff who works with the Housing and Human Services Advisory Board. And this is, I will say, you all are our last agency for the evening. You've got a subset of our Housing and Human Services agency or advisory board here. And this is intentional. We have split up our agencies based on focus area in order to allow board members to dig in more deeply on a subset of our agencies. For these funding hearings, as Eliberto mentioned, these hearings are considered public meetings. We have 3 members of the board, which is enough to mean that we are being recorded, and this will be available for constituents and others to view. Each agency gets 15 minutes. Aliberto will be keeping our time when we start. And typically what we do is we'll start with questions from the board and staff about your application or anything that maybe comes up about your organization. And then at the end, if there's additional time, we will give you some time to share about your organization or anything that we may have missed that you'd like to share about the program. Excuse me. Before we start the timer, it would be great if we could do a quick round of introductions for each of you and let us know your role with the organization and sort of who you are really quickly. So Leah, maybe you can start.
Yeah, so I'll start and then I'm going to introduce Mateo because he's in the library. This is Mateo. He is a tech pal and a board member. He's a student at CU. I'm Leah. I am president and chairwoman of Tech Pals. This is Bob, who's done some work with us over at Reality Garage.
Great. All right. So Aliberto, I think Bob, did you want to say anything really quickly?
No, I guess, yeah, I guess we'll see where the conversation leads and then I can add value accordingly.
Okay.
Thanks, Bob.
All right, Aliberto, I think we are ready to start the timer. And then if there are questions from board or staff, we can start there. Deanna.
Hi, so thanks for being here. You are our last organization. I'm a little slap happy because we've been here almost 4 hours. So if my questions don't make sense, just to let me know. Okay, so I'm wondering, I think this is I've been on this board 3 years and I don't recall seeing your application previously. So I think you're new, if I'm correct. Maybe you could tell us a little bit about how you think your organization is unique among other organizations we might be hearing from this evening in terms of the services you provide or the community you serve.
Okay, so I can take that on. So we are a unique service in that we are one of the only nonprofit technology training organization, but we are more than technology trainers. So you may not have seen us applying for things previously because we were already working with Boulder County. Sorry, I'm gonna move this up a bit. There we go. Now it's not driving me nuts. Sorry. Okay, I'm just adjusting my my thing. So I'm sorry. I'm a little nervous. This is my first real interview with a bunch of people, and it's really important.
We're all volunteers. We're all you don't have to be nervous in front of us. We're just regular people doing this for fun in our free time because we're crazy. So don't feel nervous about it. So I'm basically just asking you, tell me how you're different from other organizations.
Yeah, so we're different from other organizations because nobody has a mission like ours. It's enrich your life, embrace technology. So we're not the Geek Squad. We're not solving people's technology problems. I mean, yes, we do that, but we go above and beyond. We introduce people to new technology that they haven't heard of and that they can utilize in such a way that enriches their lives, whether it be setting up smart technology. With Boulder County, we're delivering Chromebooks to people, providing training for them. And then in this case here, we're looking to do this VR implementation for people with facing the end of their life with terminal illnesses. I don't see enough programs for people looking out for people who are, facing the end of their life. And then as well as for people with IDDs, intellectual and developmental disabilities. And we just, well, I'll get into that later. I don't want to veer off. Did I answer your question?
Thank you. Yes.
Aliberto or Robert, do either of you have questions you want to jump in with? Go ahead, Aliberto.
So in reading your application, what I didn't find, or what I didn't see, at least in the question around strategic goals, I'd love to learn more about what are some of your strategic goals, because I look for them in that first question around agency, narrative, and I'd love to hear more about what are you all thinking, because I know you're a pretty new organization. So what are some of the milestones that you're trying to reach, maybe funding, size, etc.?
Right. So that's a good question. Thank you. And I don't think we have specific funding goals beyond sustainability, really. That's been our key focus, and keeping our volunteer base in line, sustaining that, as well as as far as strategies go, basically we have a large internet presence. That's the answer to your question there.
Okay.
We've got over 45 5-star Google reviews, I think, or over 40, somewhere between 40 and 45. If you do a search for technology trainers for individuals with disabilities, we are the #1 hit above Imagine, which is a whole program designated just for people with disabilities. We're in the Senior Blue Book, so we get people from all over the state reaching out to us. We also have people from all over the country reaching out to us. And we have affiliates in Atlanta, out of Emory University. We've got people working we have one person in Pittsburgh. And so we hope to go national with our thing here. And we really want to, one of the things that supporting this VR program is going to do is it's going to help us achieve that milestone where now you guys now know the name Tech Pals. We're making a name for us around the county, around the city, city of Boulder, city of Longmont here specifically tonight. And so we can grow as an organization and further our mission, which is just to help as many people embrace technology and enrich their lives as possible. If I didn't answer your question, let me know and ask again.
That's fine. That's fine.
I'd like to hear a little bit specifically about the program that we're looking at here. It's sounds like it's really for providing virtual reality, augmented reality for folks with disabilities, or specifically for end-of-life care. Tell me a little bit about, sort of what has drawn your organization to this specifically.
Okay, so I think we were trying to get back to our root mission. Nothing about our mission specifically said for seniors only. And I think we are starting to be pigeonholed into this box of just helping seniors. And we love helping seniors. And we started out with Enrich Your Life, Embrace Technology. And we were going to set up smart technology for everybody. And then all the seniors hit us up, and we got pulled in that direction. So we're trying to get back to our original mission. And yes, this program is designed to provide people who are experiencing the end of their life with a once in a life, or not a once in a life, and an out of this lifetime experience, an otherwise impossible experience. Like I'm talking people that are paraplegic. Bob's got a program that he developed where they can go down, the Boulder Canyon mountain biking and skydiving in Moab and whitewater rafting. And we've got Google Earth on Steam, and they can literally go back home to the place where they grew up, and they can go walk around the street on Google Earth Street View. They can go see the pyramids. You can go check out the top of Mount Everest. It's just this unbelievable program. And I know, so one of the things that drew me to wanting to reach out to people facing the end of their life was that my dad died in a hospital in 2020 alone. And I just, if we could set up VR ultimately end goal in these hospitals and have staff that know how to run it. Bob's smiling over here. This is his goal too here. Just set it up in all these different places where people have access to this. It's a little more complicated, you know, going into a hospital facility, especially right now with COVID, but I know hospice is back taking volunteers. My mother does a lot with hospice. And I just think that it would just, it's just an amazing experience. Like if you've ever done VR, I guess, I don't know if I can ask you guys these questions, but have you guys done VR before? No. Yes?
Robert's shaking his head, yeah.
Okay, cool.
I put on the Oculus once, but that's about as much as VR I've done.
Bob, you want to try to explain what VR is like and just why it's so important?
Yeah, and I'm not completely intimate with the text of the proposals and the details of the, you know, this specific proposal, but I can speak to, you know, I've worked with Leah a bit to kind of enlighten her on a lot of the stuff that Reality Garage has done with Imagine, and you know, we've done TED Talks and you know, we've served VR. We had a place on Pearl Street Mall for a long time, and so we had lots of people doing VR in a public lounge, and so we've film festivals and the Boulder Film Festival and Denver Film Festival and so forth. So it's a unique experience with regards to, you know, you can literally transport somebody. Yeah, I've got this experience where you're in the Aspens, and then it's a breathing experience, and so you know, there's some animations.
Yes.
Breathe in, breathe out, hold your breath, and so it's kind of a breathing meditation thing, but you're in the middle of the Aspen forest, and you know, on a headset that it's really good quality, and it's like, wow, I'm really there. So that's kind of, you know, what the promise of it is. You know, there's a whole bunch of people doing virtual reality shoot 'em up games, right? But there's this other part of VR which is really nice, which is, hey, we can use it. And for Imagine, we've done vocational VR training for adults with cognitive disabilities. So you teach adults how to go bus tables at the sink, for example.
Like
we did
he's got one where you practice
how to do the mixed 12 packs. Anyway, so there's the technology is very promising. I think end of life, I think that's a nice, you know, to be able to give people experiences that, hey, I'd like to go see the mountains one more time. Well, great, here, let's take you there. And it's, you know, the technology is evolving, and so the equipment's getting easier and so forth. The Tech Pals organization is great because they've got boots on the ground, and you know, from a scale perspective, I'm kind of the creator of the technology, whereas, you know, Tech Pals is kind of more distribution and hands-on, and is able to apply that and scale that out to a larger organization. And so, you know, I'm hoping we establish a nice partnership and relationship where it's like, hey, you know, we can create, they deliver, we get feedback, we can change what we create, and off we go. But yeah, so here, but here again, the specifics of this particular proposal, you know, it's
we invited him last minute here.
Yeah, I'm coming up to speed. Don't even.
Yeah, he's got this one program that he said where people virtually learn how to ride the bus. Like just.
Yeah, I'm doing that for the Department of
Vocational Rehabilitation
in Tennessee. So basically Tennessee is they've got a whole tech. So the state has contracted us to develop how to ride a bus in VR. And then so it'll be an interactive thing. And what we do is apply airless learning techniques, and use that as it's kind of a no-fail gameplay, and it works really good with this population because that's that's how they learn. Errorless learning is a really good, if you look it up, there's all sorts of articles on it and so forth. But we've kind of munged that with VR, and it's actually looked to be a really promising combination.
So we have about 1:30 left, Caitlin. Just wanted to let you know.
Oh, sorry.
Oh, you're fine. With that amount of time left, I would like to open it up for any of the three of you, if there's anything that you'd like to share that we haven't touched on through our questions, or that maybe is not included in your application that you'd like us to know.
Yeah, so I don't know if it's possible right now to share a YouTube video interview that we did with a woman. It's like 2 minutes long, post a pilot VR event that
very
we
impactful.
What was
The
that?
interview was very impactful.
We probably can't do that in this meeting, but if you want to send us the link, I can send it to this group of board members.
Absolutely. I'll send it in the email that was sent to me for this. Does that work?
That's great.
Great, yeah. And then also you can just go right on YouTube and search Tech Pals, and it's right there. It's our latest video. It's the interview. It's 2 minutes. It's really powerful. Her daughter had an intellectual developmental disability, and she came and she loved it.
All right. So we got about, time is.
That was it.
We got about 12 seconds left. Sorry. So.
Oh, so there are 2.34 million hits on virtual reality benefits on Google Scholar.
Okay. Awesome. All right.
All right.
Thank
you all for your time.
Thank you all. Have a good night.
Thank you. Sorry I couldn't talk
Have a
much.
good night.
You
Bye.
guys have a good night.
All right.
Have a good night. Thank you.
Thank you.
All right. So done through the first long night.
We did it.
Yes. I think there's another long night. And Caitlin, this is to think about for the board is, once again, not our top priority gets the most hits, right? So yeah, I don't know how to fix that. I'm just throwing it out there.
Yeah. I mean, it may be the unfixable problem, right? Because it's the biggest priority is the biggest priority because there's not enough hits, right? So
yeah.
I don't know.
All right.
Thank
you
you.
all I know it's a long night. We really appreciate it.
Thank you. I know it was a long night for you to work, Alberto. Thank you.
That's right. Thank you.
And Brenda.
Good night.
Thank you.
Bye.
Bye-bye.
Thanks, Alberto. Thanks, Brenda.
Bye-bye.
Bye.